Good evening, members, to this evening's Health and Adult Social Care Overview and Scrutiny Committee. Do I have any apologies for absence? It's loud. Councillor Goldwyn.
Councillor Perfect, Chair.
Sorry, we've just got to deal with the volume control on it. Councillor Goldwyn, you're...
Councillor Perfect, Chair.
Thank you very much. Anything else, Terry? No other tonight? Can I sign, members, the record of the meeting held on the 20th of August 2025 is correct? Is that agreed? Agreed, thank you. Urgent matters, Terry first.
Thank you, Chair. So we have no urgent matters. What we have noticed is an error in the Council Plan Monitoring Report. So some of the data that was provided into the system hasn't come out. So it's missing quite a lot of the data. So we're proposing that we defer that item and take Q1 and Q2 together at the December meeting, if members are happy.
Is that okay, members? Thank you for that. And before we begin today's meeting, I'd like to take a moment to acknowledge that we are coming to the end of Baby Loss Awareness Week, a time to remember the babies whose lives were far too short and to reflect on the profound impact that such loss has on parents, siblings, grandparents and the wider family network. This week reminds us of the importance of compassion, understanding and open conversation, and recognising that the effects of baby loss reach far beyond the immediate family and touch entire communities. As a symbol of remembrance, I will now turn the candle on. We won't light one. I will turn the candle on to honour all those babies who are no longer with us and to recognise the enduring love and strength of the families who continue to hold them in their hearts. Thank you, members. Are there any disclosable pecuniary interests or other significant interests or whipping, members? None? Okay. Oh, yeah, Councillor Campbell.
In relation to the item about pharmacy provision in Rainham, my day job, I work for the MP of Gillingham and Rainham, and I understand she has involvement in this issue, and she has written to people on this matter and has had several discussions. I just want to disclose that, but I have had no involvement with this matter from that office. It's the team of caseworkers and the parliamentary assistant working on it, so I have no direct involvement. Thank you.
Thank you very much, Councillor Campbell. I'd just like to remind all those speaking tonight to keep the introductions to a bare minimum. We have a very heavy agenda. Members, just take it that members have read the paper, so please use your introduction just to update members on anything that are not included or to draw attention to the very key points. And now moving on to item 5, welcome Councillor Murray to this evening's meeting. We're now holding you to account. So over to you for just any highlights, please.
Thank you very much, Dan, and everybody for inviting me. And can I first of all say, Dan, I think it's incredibly important that we're reflecting Baby Loss Week this evening. It's an area of our health and well-being that's often neglected, actually, and not spoken of for the reasons that you laid out. And I think in particular for me, we can do more for those who suffer a miscarriage, including people who've been through the process of IVF, because that can be a very painful, very expensive, very lengthy process. And when it results in the loss of a longed-for baby, it's very, very hard. And I'd like to pay tribute to Rochester Cathedral, who do a really good job in commemorating Baby Loss Week and other organisations in the voluntary sector. And also to friends from Medway Foundation Trust, because I know they are trying hard, working with staff and working with patients and ex-patients to get a baby loss garden on the hospital site. And although there have been various problems, I hope that happens.
Teresa, can I just ask you to pull your mic closer to you, just for other members? That's great. Thank you very much.
Okay, is that better? People don't normally have difficulty hearing me, but there we are. Anyway, I hope that people have read the report, and I hope that you enjoyed it, because I'm very sincere when I say it's been a busy and eventful year. The thanks to all of those people who have supported me and supported our community in Medway is laid out. And for me, particular highlights are the right sizing of adult social care. We're nearly through that now and the restructuring, and we've got lots of new staff in place, heads of service, making a fantastic support team for Jackie, who I will remind people had only 2 heads of service compared to 7 in the Regeneration Directorate when we took over. She's now fully up to complement, and the work that we've been able to do on getting people to focus far more on the budget and being more open and transparent has resulted in some efficiencies. There is always more to do. Things are not perfect, but I'm very pleased with progress, and I do pay tribute actually to Jackie and the team for the work that they've done this year on changing things. In public health, I'm particularly proud of the work that's been happening with the Health Determinants Research Collaboration. I'm very interested in evidence-based policy making and the way that they have managed to involve lots of people across the council and from the wider community in the research collaboration has been praised actually externally, because it's starting to make a real difference, and we're attracting quite a lot of national interest, and I hope that that will grow more. There'll be another members' workshop either later this year or early next year, and the more people that can get involved, the better. Work on the prevention agenda has happened at pace. We've now got a whole range of falls prevention classes taking place right across the community. And in fact, when I was at Medway Hospital this morning doing a governor's tea and chat, somebody who lives in my ward came up to me, and I'd seen her in the summer just after she had a knee replacement, and she said to me, "Thank goodness I saw you and you told me about those classes. It's really changed everything for me. I've got my knee working, I've made new friends, staff are lovely to me." And, you know, that was just somebody meeting in the street, and is a small but very important part of all the work we're doing on prevention, culminating in being able to start our work and fulfill a long-held ambition of our late director, James Williams, to become a Marmot Place, which I think will give us complementary work, access to resources, ideas, support, and thank you to everybody that came to the launch, well over 100 people. And we're looking forward to that making a big impact on those still very pervasive health inequalities. So they're the things that I'm particularly pleased and proud of. It's been great to work with the local plan. I've attended all the meetings except one on health estates, so that we make sure the local plan reflects the infrastructure that we need, and that's been a very worthwhile activity. And last week we had the Safeguarding Executive, where Jackie was able to give a presentation about our newly formed and very active intensive support team, which is mentioned in the report. We had on Wednesday the Drug and Alcohol Prevention Conference, the 3rd one of those, very successful, lots of partners there. And on Thursday, our provider conference, meeting up with partners in the care sector, and actually the Chief Executive and I were very pleased to make some awards. At every single one of those, people praised Medway Council actually, said that they thought the work we were doing was very good, and for some people really looking forward to local government reform because they can see that working in a single tier situation gets things done. These were unprompted remarks that I was pleased to receive. I was at all of those events and very proud of our staff there. And finally, the James Williams Health Centre, due to open early next year, work happening at pace, 217 rooms in that health centre, which will be not just used for the GP practices that will go there, but for therapeutic activities, space for communities, space for our social care staff to co-locate and get involved with people, so we wrap around some of those very complex people in that extremely disadvantaged part of Chatham, because that's where we've got people who are getting sick too early in life, who are not working, who are not achieving their best potential. So I think the health centre being located in the Pentagon will be one way anyway to give them a boost that they need. Thank you, Dan.
Thank you, Councillor Murray. I do want to just recognise the breadth of work covered in the report, and definitely I know members want to recognise the amount of work that officers put into the work day to day. That being said, as you will know, Councillor Murray, that being said, and for all members, the role of this committee is to look beneath the positive headlines and also look at the impact a lot of that good work is having on our residents day to day. So if we can focus the questions on that, around the impact and around the day-to-day life of our residents, that would be really good. Open to members. Councillor Name.
Chair of the PNA Steering Committee. Now, as from the report, as you clearly stated, the definition of a gap in the context of the pharmaceutical need assessment may differ from how the public perceive the availability of the access to pharmacies within the report. And it's reassuring to know that your report recognizes that should circumstances change within the next 3 years before the next PNA is due, the Health and Wellbeing Board may issue what is known as a supplementary statement to update its conclusion. Now, however, the residents of Rainham North would like to request that the board issue such as a supplementary statement as a matter of urgency, because they cannot wait for another 3 years, as the current PNA report does not accurately reflect the real situation on the ground regarding access to pharmaceutical service, particularly for our aging population. During the PNA assessment period, Guild's pharmacy may have been technically operating and therefore counted as one of the 2 pharmacies in Rainham Central. However, its services was providing only a faithful service, and this should have been properly considered when assessing local provision. Residents, therefore, in Rainham seek clarification on several key points. First, they want to find out the nearest accessible pharmacy for those living along Lower Rainham Road, especially for residents without private vehicles. Secondly, they also want to know why Rainham was grouped as one community, the whole Rainham being considered as a community without splitting them into various wards. They also want to know, with Guild's Pharmacy, they hold a service contract, and who was responsible for monitoring their performance. Fourthly,
Councillor Nain, I'm just going to have to stop you a moment. I think anything on P&A only is what Teresa will be able to answer, because we've got an item coming up next about Rainham Pharmacy. So we've got Suk and others here from the ICB, as well as David, to talk about the actual pharmacy provision in Rainham. So what Teresa can answer the P&A stuff as chair of the Health and Wellbeing Board, but what I don't want to do, Teresa, I mean, you're more than welcome if you're staying to comment when we get to the Rainham Pharmacy part. What I don't want to do is repeat ourselves on 2 items. So we can carry on with the question now for Teresa and just concentrate on the P&A bit, or you might want to hold that until we get the pharmacy question in a couple of items' time.
Okay, then I'll keep the question up to the second question. Then the other bit can be taken by the...
And I will bring you straight in as number 1 on the pharmacy item, Councillor Name. Teresa, do you want to answer about the P&A?
Yes, very, very happy to do that. Councillor Nang, you'll know, but forgive me for repeating it, the P&A is a statutory function that the Health and Wellbeing Board has to oversee through a steering group every 3 years. It's a national framework, not set by us, and the sufficiency standards in there are also nationally set. So I absolutely understand and support the concerns that you and other councillors in Rainham have expressed for people who live in the centre of Rainham. The P&A will talk about the sufficiency for Rainham as a whole area, and in the terms of the P&A and the standards within it, there is a sufficiency. As part of the steering group work, we discussed this quite a lot, actually, because apart from being concerned about what was happening in Rainham at the time, I was very concerned about the situation on the peninsula, where there's only 1 pharmacy. Now, albeit there are many fewer people, nevertheless, the access for people on the peninsula is very limited indeed, and there was nothing we could do. The fact that they're 10 miles from Rochester was seen to be sufficient. I made the point that I'm sure you've made about bus services and people who haven't got access to a car and all of those things, but they are not things that the P&A standards of and in themselves take care of. So one of the things I know that Nishaba's doing, and certainly I have agreed to join her in that, is to try to ensure that in future the P&A does actually cover something about actual day-to-day accessibility and thinks about protected characteristics in the way that people access pharmacies. I have got a small bit of good news for you in the sense that the ICB have been very pleased to be involved in this with another local pharmacy, have given 23 days for a mobile vaccination unit that will be going to Rainham, another. Now, I know that's only part of the services that people want, but at least it's a way of ensuring that people in Rainham will get access to a really important service. There'll be 23 days and a schedule published in November and December because we're a very under-vaccinated population. I've also asked the Healthy Living Centre, well, would it be possible for them to put a pop-up provision there because they've got a pop-up provision for vaccinations? The answer to that was no, because they haven't got the right kind of security and storage that is expected of a pharmacy. And to Councillor Anang's general question, Dan, who oversees the performance? Well, the ICB do that. The General Pharmaceutical Council also do that, and they've got an inspection regime, particularly focusing on prescribing pharmacies. But I think, as you'll probably hear in the item that you've got, and it's right to scrutinise it, I'm afraid youths are suffering right over the country, and there are lots and lots of problems with that particular group that we can't either take responsibility for or go in for, but it is something that we do need to be aware of. So I'll be looking forward to what the ICB have got to say about the possibility of someone else taking over that pharmacy. I was in Rainham on Friday because I did a visit to the credit union, so I went into the shopping centre to have a look around and see the notice on their door and talk to a few people. And yes, people are disappointed and feel like they're losing out. But the P&A, as things stand at the moment, and I'm happy to put a supplementary report in there, isn't the vehicle that will change the situation in Rainham as things stand in the moment. And the other thing I would say to you, we did quite a lot to get people to take part in the P&A. I made a video that was put out on social media. I visited pharmacies myself. Only 3 pharmacies actually responded. And in fact, very, very few people, despite putting notices out, doing the social media, putting stuff in doctors' surgeries. And I think had that happened, we might have been, at an earlier stage, been able to perhaps reflect a bit more than we actually did as a steering group in the P&A. But I think it is a bit of a flawed system. It does need changing to reflect accessibility, and there are things that we can collectively do as a health community to try to improve the situation in Rainham.
Thank you, Councillor Murray. And just for those that may be watching online, I know I always do ask everybody to keep the acronyms down, and that's very difficult in our world. But for those that are watching, P&A's Pharmaceutical Needs Assessment, just in case people are trying to look it up. Councillor Wildey.
Thank you. Hello, Councillor Murray. First, can I say about baby loss? My mother, so I'm going back a very long time, she had miscarriages, and now I was young at the time, but it did seem to me the next day you get up and you're supposed to carry on with your life. So, not within the family, but outside. So things have moved on. I still think there's much more to do, but I'm grateful for the improvements and my sympathy for everybody. In your introduction, you mentioned safeguarding. Before this meeting, I was talking to Jackie. On, I think it's page 50, you've got the numbers of safeguarding complaints, and there was only one, which, now that one must be very important, but I think we should all thank Jackie's team, because to only have one safeguarding complaint is a reasonably good place to be. Naught is better, but so if you could join with me, I just wanted to mention that, not really a question, but going on to a question, page 23, 3.2.3 on the mental health. The report states that funding has gone up from 985,000 to 6.5 million, that's over 5 years. Do you know that the numbers, now we all know because of COVID there's been a great jump in numbers. Do you know the numbers and how they have risen over that 5 years? And I do understand that's a technical question, if you like, so a briefing paper later would be great, or just an email, but I don't know if you wanted to comment.
I haven't got the numbers, but I'm sure that Jackie and Leanne will very happily provide them. One of the things that I can say, that despite that increase in funding, it isn't enough. And something that we are seeing in adult social care is a huge change in the number of people who are being deemed by mental health services as medically fit for discharge and no longer entitled to NHS continuing care. And that has resulted, and if I just give you a couple of examples without naming who they are, us being asked to provide four-handed care for someone who's so unwell, that's what they need to prevent them from harming themselves, at the cost of £7,000 a week. Now, even if within the social care community we had specialist workers who were able to cope with that, the gap between what they are paid and what mental health nurses are paid is huge. So it would be very difficult to get people. And we're just not in a position to facilitate that, I'm afraid. So for Jackie and the team, when these kind of things come to panel, we're suddenly involved in an awful lot of pushback to explain that situation. Now, you probably know that KMPT have had a very poor CQC report. They attended the Kent and Medway Safeguarding Executive Board on Tuesday and gave a pretty good account of how they intend to improve. But I will say to you, Councillor Wildey, I'm worried about that, particularly because they're taking on CAMS in April. There's been a direct award to them from the Integrated Care Board, with no experience within that organisation of children's mental health. And in adult mental health, they've got problems. There's been huge churn at the top of the organisation and lots of difficulties along the way in the context, as you're alluding to, of rising numbers. Now, there are things that we can do, and one of the things that those of you on children's have probably heard about and will do in the new year is a really innovative piece of commissioning to put a therapeutic alliance together for young children and young people, so that before a psychological diagnosis is made, there are therapeutic interventions along the way with a collective. And I'm very hopeful about that, and I would like to think that we can put something like that together for adults in the future, because one of the problems with mental health services, including in the voluntary sector, they're very difficult to navigate. And you and I have heard that from many people over many years, and it hasn't actually got any better. So as many representations as I can, I am making. I'm working with officers to try to protect council adult social care in explaining our position and making it clear that when we're asked to do something that we can't possibly fulfill, we don't just roll over and try and do it. We actually say no and push back and think about a different way of doing things. And I'm hopeful that the government, particularly as part of the 10-year plan, will recognise the fact that mental health has been underfunded for a long time and support us to change things. But as an area of concern, it's a big one for me.
Thank you. Page 41, and I know I'm jumping about, residents with direct payments. Do you know if there are many that have had direct payments and then decided not to have them, or what's the percentage? Because direct payments was never as successful as we, the council, over a number of years wanted them to be.
And we're still below target, Councillor Wildey, and I think there's lots of good reasons for that. I think particularly where a family are involved in caring for somebody, for many of them, they just don't want the trouble of managing finances. And actually, I understand that completely. And I would always want to make sure that we support those people. When somebody gets direct payments, that it's really critical to put in a lot of safeguards to make sure that the money isn't being improperly used, and that takes a lot of monitoring, and I think people know and understand that and sometimes feel that it might be a bit invasive. On the other hand, for those people who've got direct payments successfully, it can open up a whole new world and give people who need caring for a lot of choice. So I think, you know, my view is, and we look at this, it's in the adult social care account. We've looked at it again in the new strategy that's being consulted on at the moment. We'll continue to push on it, but it has to be in the context of it being safe and people not feeling, in my view, that they're forced to do it.
Do you think direct payments put, say, a daycare centre for people with dementia, if you're running that sort of service and your clients all get direct payments, some might drop off, some might not. Have you, and again, this goes back over years, but are you aware of any pressures at the moment, particularly?
I think we've got strong enough relationships with our providers. We meet them every month, and when I can, so I think I've probably attended about 60–70% of those monthly meetings to hear what providers have got to say. Yes, that is definitely a problem. It makes it hard to hold a business plan when people can decide that they don't want to do something anymore and will be looking for alternatives. I do think there's space for us to look again at our own day services, actually. And now we're pushing through the right sizing. That's something on the horizon, I think, that hasn't been reviewed for a long time. There's a new manager at Our Zone. You might know that in Pattons Lane in Rochester. I'll be going along there for a visit to hear what they've got to offer. And I always regret the loss of what was Robert Bean Lodge, now the Rochester Care Home, and Shaw's Wood, because in the times when we had those facilities, we had our own day services that we could actually overlook and be flexible and change as people's needs changed. Direct payments means, as things stand at the moment, that if you've got direct payments, you can't then buy a council facility. But I think that's something the government need to look at again, because we're well placed to run day services. We need to think a bit more about what we do. And I've got every sympathy with providers who find that it's a sort of capricious system that they can't always rely on.
Councillor Whitey, if you want to ask another one, I will come back to you. I want to move around a bit more and then I can come back. So if you want to ask one more, then I'll come back to you as well. Okay,
then I'll go to my most awkward one. How much did cutting the winter fuel allowance affect the people of Medway? I remember at the council meeting, I asked if you were proud of the government making that decision to cut the winter fuel allowance. And you indicated that you were, and now the government have changed course, of course. And at the time, did you realise that that would cost the pensioners of Medway between £7.5 and £10 million?
So in order of what you've said, yes, yes and no. So I do think it was a bold step. I'm not saying that it was the best or the right step, and I don't think I ever said that. And one of the things that I immediately did with the help of council officers, in particular our welfare and benefit team, was to put on as much support as we could for people coming forward and claiming pension credit. We identified people who we thought were entitled to it, who were not getting it. We held several events, including a roadshow, and had a really good result in people coming forward. And we also gave a special payment through the Household Support Fund, now changing its name to the Resilience Fund, but secured for the next 3 years, of £200 to the poorest households. The government have rolled back on that. There's no question about that. You're right. The shape of exactly what it will be, I don't know. I do think that there were some people who really missed out and felt the loss of that payment, and many people who didn't. And actually, some of those didn't mind losing it in the interests of clearing up the mess that the last government made. But I'll continue to keep a watching brief, and whatever we can do locally, we'll continue to do, especially now we've got a secure future with the Resilience Fund, that we can plan that much better than when it was year on year.
So sorry, just follow up on that. So even though you accept that it did harm to our most vulnerable elderly, you're still proud of that decision?
I don't accept that it harmed the most vulnerable elderly, because the most vulnerable elderly are people in receipt of pension credit, and they continued to have the winter fuel allowance. I'm still proud of my government. I understand how tough the decisions were, just as we've had to make tough decisions clearing up your mess. So I will continue to support them, continue to be proud of them, and when things go wrong, throw up our hands and do something different.
Thank you.
Thank you, Councillor Wiley. Councillor Campbell.
Thank you, Chair. There are some really great things to see here, like the care home being built. I mean, the overall picture, reading the report, is that the pressures are building and resources are scarce, and it's almost a race against time to try and meet those demands. So things like the care home being built, that's great, because that's taking a step ahead of that sort of race instead of just always playing catch up. That's really great to see. In terms of your I remember pretty early on when you took over this role, you put that plan in place to right-size adult social care services. So obviously there was a significant gap where we needed to be and where we actually were. And the same thing with the whole transformation project since the CQC report. So have you managed to reduce that gap in terms of staffing and resources, and also in terms of how services are delivered? How would you, like, if you had to give an assessment of how far have you come towards reaching where you want to be, is there an end in sight to this?
I don't think there's an end in sight, because demand will continue to rise, and we'll have to adjust to that. And I think a more foresighted administration than the last administration would have used public health intelligence to understand that, and not torn the guts out of adult social care in the way that they did. What the right sizing has done is put back what was taken out, but what we haven't done is put in anything extra to meet the extra demand. And I'm afraid that that will probably have to come. I'm hopeful that Louise Casey will have a really good look on behalf of the government at adult social care and come forward with some new proposals. But what I can assure you, Smither, is we have improved the standard of care. We've got 80 new, more than 80 new staff, actually. Many of them social workers from different areas who've been very pleased to come to Medway. And a couple of weeks ago, we had the whole division together at Lordswood Leisure Centre. And I was really impressed with the way that some of the new people have helped us refresh and professionalise some of the practice that was really sort of on its knees and just coping. People have come with fresh eyes because they know the investment has gone in, and started to have a much more professional, strategic way of looking at things. And I was particularly pleased to see that one of the team leaders is really pushing on having a strategic plan for everybody that we care for, so that we're standing around people with all of the services who can help them, and putting all of those services into the plan. And just sharing with you, we had a guy come who on one occasion in his life had been banned from Gun Wharf. That's how bad things had got for him. He was going into prison about every 18 months or 2 years. He was leading a shockingly chaotic life. This is someone with, quite profound needs of vulnerability and learning difficulties. But taking a different approach to his life. He's been out of prison for 2 years. He's cooking, going to the gym, making friends with people, attending a weekly disco. Jackie is going to, I think you probably did already, didn't you, due to go to the disco with him. And the social worker brought him along to talk to everybody. And it was actually really heartwarming. I think we all had, tears in our eyes, actually, to hear him say what he said to me directly when I thanked him for coming along. I'm a normal person now. he said. He's got a personal assistant who takes him shopping. He does things for himself and feels completely different. Now, if I could achieve that for every single person who needs it, that would be great. We're a long way from doing that. But what I think has happened is that we know how to do it, and we're putting in place as much as we can for as many people as we can to make that happen. We could probably do with another 80 new staff, actually. We put in 2.5 million, not enough, but it got things back where they should be, and I think has motivated and energised people and made them feel that we value the work that they do. I would never say it was perfect. Something goes wrong every single day that needs putting right and thinking about, but things are better, and people are less fearful of coming forward when there's a problem, and more likely, I think, to share things.
Thank you for that, Councillor Murray. Actually, that's such a wonderful story. And sometimes when you just look at reports and gaps in terms of numbers, you miss that sort of qualitative data. So it's really important to have that human element to some of what we look at. On that note, though related, it's a bit disappointing to say in the complaint section that the largest chunk of complaints tend to be about lack of communication. And I have been in vulnerable positions, being a carer and in, being supported by the adult social care team. And that's the worst that can happen, is you just don't know what's happening. You just think you've just lost in the system. You're lost in the system. So, I mean, it also, to me, it seems like that's a pretty easy thing to fix, right? Just let people know, bring them along on the journey with you, saying we are stretched. So, you probably don't have an answer to it, and it's probably because people are so overstretched and you just don't have enough right resources in the right place. But I think that should be pretty top priority for the service, to keep people informed at every stage of where they are with the care, and to just be honest and transparent when there are delays, so they don't feel like they're just left hanging.
Yeah, thank you, Smitha. That's my biggest postbag too. So you're absolutely right. In part, it has been about sufficiency and capability, and sometimes it's about just not answering that phone call because you're busy doing something else. Now, the use of AI, magic notes, the famous bit of kit that allows people to, if you like, effectively, it's a souped-up dictaphone to record assessments and things that they're doing, and then it will write them. So that we estimate that saves social workers about 5 hours a week. I hope to do more of the kinds of things that you're talking about. But we've got to get better at communicating with people. It's a source of huge frustration when somebody's waiting for an assessment, when they're waiting to go into a care home. And we've got far more people waiting than we would like because we just haven't got the places for them, which is obviously part of why we're putting together the Care for Medway thing. One of the things that I'm hoping we'll be able to do is get a portal with Medway 2.0, a digital portal that people can go into and at the very least see where they're up to. Now, given, in a conversation I had with Jackie a couple of days ago, she really made an impression on me by saying, look, we're a huge spender, and we are, spending 25% and more of the total council budget. Shouldn't we be prioritising the digital needs of adult social care? And I think that is absolutely right. So I'm hopeful that will come, open to ideas, and I hope honest about the fact that it's an area that we need to improve.
Thank you, Councillor Campbell. I'm going to come to Councillor Prenter. Also, I will say Councillor Prenter was with me during the week. We've done something in Twitter, didn't we, Councillor Prenter, about baby loss? If you want to comment on that quickly, with yourself and Councillor Brown with me.
No, it was very significant and very moving, meeting people who have been affected by baby loss. It was just a small thing for us to do, and we're hoping that we can expand this to really become part of Medway and honouring those who have gone through that. So thank you, Councillor MacDonald. Now to my questions, really a comment on care homes, firstly. Been through this process, I mean, throughout the years of Tory administration here in Medway, we've seen community provision for care on discharge from hospital reduced. This caused a huge impact on the bed blocking that we have seen in Medway Hospital and a knock-on effect to admissions to those wards. This move to create a council-owned and run care home with the assessment beds and re-enablement services shows decisive action, for which I am pleased to see it move forward. And hopefully we can take control back from the market with that and give our residents that choice to go into a care home when they need. The other part I want to touch on is the falls prevention service. It doesn't sound that significant of a thing to stop people falling over, but seeing how the impact can have on individuals' independence from a fall. I mean, in the report it says that the cost is about 14,000. I actually don't think that touches, because the amount of people that lose their independence that then have to go into care homes or have carers come because they've lost that independence. And I think there's a statistic, once you've had your first fall, there's more chance of having a second fall again and again. But the report mentions that the service has around 200 referrals in the first quarter. How many can the service realistically help in a year? And is there an end date for the funding, or is it an ongoing service, as there is obviously a significant need that we've seen by the amount of referrals that we've seen through that? Thank you.
Yeah, thank you. And David might come in with some statistics when I've finished talking about this. You're absolutely right, Mark. It's a critical part of our service. And what you said, one of the greatest predictors of having a fall is having had one before. We've done quite a lot of work on this, using public health intelligence. And one of the things we found that was quite startling, and I think I probably mentioned it last year and it's still true this year, is that 40% of the falls all happen in the same ward, Chatham Central and Brompton. So we've been having a look at, apart from putting in place things to improve people's strength and balance, well, what's happening there? You know, is it about the state of the highways? Is it about accommodation? Is it the fact that there's a group of people we're just not reaching to help with assistive technology that can, you know, predict falls, tell us when they've had a fall? Is it about the fact that when somebody does have a fall, it doesn't get all the way through the health system and there isn't sharing of that intelligence to make sure we keep a special eye on those kinds of things? The falls prevention classes are quite targeted, so people that, you know, we know can benefit are being invited to come with those referrals, but people can self-refer as well. And I think as we get going, and the public health team have kind of changed the way they present things to make the exercises be something that you can do anytime, anywhere. So if I just give you an example, when we were at the provider conference this week, Nikki Chawner, who is one of our exercise leaders in public health, led everybody at the conference with an exercise using a tea towel. So we were all given a tea towel, and we were using the tea towel as a resistance band instead of having a resistance band, an everyday household item. And she ran us through a workout with that. So there's been a bit of a pivot to try to say, look, you know, we're not making you into a super, you know, aerobic fitness. This is about doing everyday things that you can do anywhere that will definitely sort of improve your strength and balance. And I think that's part of attracting people, because people, you know, some people say they won't come along because they think, oh, they haven't got the right clothes, or they, you know, everyone's going to laugh at them, or they won't, you know, be able to do all of the things. In fact, when they do get there, and of course it's always getting people there that's the important part of it, they find a friendly, welcoming environment where you can have a cup of tea and do the kinds of things that I've just described. So in terms of capacity, I'll defer to David for that. We're pleased with the number of people who've joined so far. And if I just touch on what you said about care for Medway, you know, it's a bit nail-biting, borrowing 40 million to do that, but we've got to. When I was in opposition, I absolutely opposed selling care homes, and they were sold on the rationale that we don't want to pay for empty beds. Now, anyone, even back then, who'd looked at the statistics of what was coming would have known that actually there aren't going to be any empty beds for many a long year. And our care home will be, I think, modern and innovative. There will be those complex dementia beds, which we're very short of. But there'll be short-term reablement beds where people can get therapeutic advice, help and support to get them back into their home, which is, after all, where most people want to stay and be as independent for as long. There'll be training there. Our assistive technology partners, Kindy, will be absolutely embedded in that, so that we use the assistive technology as part of the care home and then carry that into care packages and into the home, and that's developing all the time. In fact, India having an exhibition at Mid-Kent College soon, a public exhibition. And as you know, they've already been to see you at Scrutiny. They came to see us at the Adult Social Care Divisional meeting, so that social workers feel confident about recommending all of the things that are available now. So there's a lot happening, and I think we've picked the right time. And after all, having Medway Innovation Park with tumbleweed knocking around for all of those years hasn't been a good look. Now there'll be something there that will not just be the thing that we need to look after people, but a generator of economic life. And I think that's really important too. And as Simon Curry will tell you, it's going to be fully sustainable. And that's a good thing. So I'm ever so hopeful. Hope that it will be approved by full council on Thursday. And I'm looking forward to working with anybody who wants to work with us to make that into the best facility we can. So David, if you want to say a bit more about falls prevention, please.
Yeah, I'll keep this brief. So, yes, we're aiming to provide the service for 800 people. And we are actually currently ahead of target to reach that number within the year. So things are going very, very well in terms of recruitment to that. Falls prevention itself is a very effective program, very efficient program. For every 11 people that we provide the service to, we prevent on average one fall. And each fall costs the system quite a lot of money, and therefore the whole intervention itself pays for itself very, very quickly.
Thank you, David. Councillor Brennan, just briefly.
Yeah, just quickly, I think we just need to make sure we pick up those people, because we are talking a very independent, very resilient part of society who might not think that they're close to a fall. So we just need to make sure that we can pick those people up as well. But thank you.
100%, Councillor Brenner. Members, I have got 5 people. I want to keep the questions direct and the answers direct, please, Councillor Murray, because I've got 10 minutes left for this item. Councillor Hamadishi.
Thank you, Councillor Murray, for your report. I'll be very, very quick because some of the bits have already been captured already. Back to point 3.2.3, you know, the stark rise in resources and money required to sustain mental health services, along with social care, is stark, is massive. To the unqualified individual out there who doesn't really know what social services do or why they do what they do, don't understand what carers do until they actually get a carer, I think it might be useful as a recommendation first to do a day in the life of, to describe some of this information here, because I think it flies over people's heads that they see 178%, but don't understand, kind of contextualize it. I think it's disingenuous to think that COVID was a tipping point for all of this. It's been brewing for over 14 years. We all know that, and people are living longer. So I can see this figure getting more and more spaghettified. So my question to you is, I know you like it. My question to you is about how much of that money that's been singled out involves re-enabling some of, educating social workers to work in transition with nurses, to almost like create hybrid roles for the new care needs for the future?
I think, Douglas, that's a piece of work that needs doing more than we have. And I alluded to at the beginning what it's like for people who are working in social care to take on somebody who's got mental health problems or indeed develops them. We've got to do more to support our own staff to do that. Absolutely any partnership working that we can do. And I think KMPT's recent experience with CQC has made them think more seriously than they were thinking and more deliberatively than they were thinking about how they can work with other people. Because one of the things, and as a professional, you'll see this as well, that frustrates me enormously is when I go to the safeguarding executive and hear case studies, the story is always the same. Someone didn't go round. Somebody didn't go back again when they didn't get an answer. Somebody ended up committing suicide as a result. And then at a lower level, We've got people working in supported housing who are just not equipped to cope with some of the things that they're coping with and need the kind of training and support. And I'm afraid salaries that would encourage them to work with some of these very complex people. So it's an area that we've got to face up to. And yes, doing a day in the life of somebody who's working with that, maybe for Scrutiny, maybe as a video that we can make and share would be a really good idea. I'd love to work with you on that, and I'm sure that Jackie and the team would as well. It would be very, very helpful, because getting those shared perspectives, I think, is critical. You know, in the sort of case that I described, where we were saying we just can't do that, you can imagine how social care staff feel faced with that. You know, what on earth would they do? It's quite outside of their experience, and we need recognition. You know, we need to wear each other's shoes far more than we've been doing. So any ideas that you've got, and I know you've always got lots of ideas, it would be great to share them.
Thank you, Councillor Mdiju. Thank you. And that's an action we will take at the end of the briefing as well. That one, yeah. Councillor Cook.
Thank you. I'll just preface a brief question with just personally, like a lot of people in Medway Hospital has been central to our lives and the support given. And I'm sure a lot of women will think of the same corridor as I do when we think about Baby Loss Week. You know, Medway Hospital supported me through the loss of 2 pregnancies. And where I wanted to go with that is that then a year later, I was in the same hospital giving birth, you know, thank God, to my eldest daughter. And I had such fabulous support, but the support that I didn't get was around breastfeeding. And that then became a significant part of my story as a young mum. 4 years later, I then had fantastic support at Oliver Fisher with a premature baby who is now, as I say, 15. I had much better support, and again, a significant part of our story. And so I read page 26 again and again, because it's something we just don't hear enough about. And I guess very briefly, just to highlight that and say thank you, but also then to say that there's so much of that again in that partnership working that we've just been talking about. And I'm aware there's so much here that is reliant on other health professionals, because as a young mum, you're working with huge amounts of people at once. So how are we kind of working with this part of the story around with other professionals so that the mum in the centre and the baby in the centre gets a shared and a joint up message and support? Thank you.
No, thank you. And I'm sorry for the losses that you experienced, Esther. And thank you for sharing those with us. I'm very proud of the Beside You piece of work and the associated things that we've been able to do online to make that even stronger. The growth of cafes where people can do breastfeeding and normalising that, and the recognition that I think we've shown through actually our food strategy that infant feeding is such an important part of giving people a good start in life. And one of the things that we've seen through the blooming bumps, where women who are pregnant and dads as well go on walks together, is sort of developing through Beside You with peer support, which is absolutely critical. One of the things that is really missing from this is Sure Start, of course, which made a tremendous difference to all of these things and had a fantastic estate. We're hoping to restore some of that with the best start in life, and the family hubs are doing as well as they can, but they need more capacity. You're absolutely right about that. And I think one of the complementary pieces of work that we need to do is be able to offer more to people collectively as a system about what it takes to have a healthy pregnancy. We do a lot about avoiding pregnancy, actually, in terms of family planning, but we don't do an enormous amount about, well, what does it mean to achieve a healthy conception and have a healthy pregnancy? And I think that's something that's still a bit of a missing link, really. You know, miscarriage can be just a very mysterious, natural part of the life cycle, but there are things that people can do to give themselves the best chance. So all of the stuff about smoking cessation, you know, having a healthy diet, not drinking, taking exercise, making sure that, you know, your body's in the best shape that it can to withhold a pregnancy. I think we don't publicise enough You know, we look at the prevention bit, we look at the end game of when the baby comes, we support people as they get towards the end of their pregnancy. But for that bit before and the bit immediately after, we've still got some room to strengthen it. But the Beside You programme is a really good start, I think.
Thank you, Councillor Cook. Councillor Shocker.
Thank you, Dan. So we are now a Marmot Place, so thank you to you and the officers for that, for implementing that. It could be a really big deal for our communities. I was lucky enough to be at the launch event in April. It was put across quite clearly from Sir Michael Marmot that the policies of the last Tory government has made a significant measurable negative impact on life expectancy in Medway for its disadvantaged communities, and a country being a G7 country as well. This has been reflected in the 10-year ambition. How do you feel Marmot Place can start having an impact into reversing the damage already done by then to our communities?
Yeah, Sir Michael doesn't hold back, does he? And that's one of the reasons that he's such a great speaker and why he's got international renown, actually. It's not as if we're starting from zero, because, of course, we've known about health inequality and been doing lots of things through the Health and Wellbeing Board and all of the associated activities, including the Joint Health and Wellbeing Strategy, to try to make an impact. But I think what Marmot does, and it's a 10-year project, it's put us into a position to have more access to resources and learning and ideas and work with other people who've been successful. And one of the first things that we're going to have a really big focus on under Marmot is the number of young people who are not in education or training, because we've seen a huge spike in Medway that makes us an outlier. There's going to be an inclusion conference in November through Children's Services, and then a bigger conference focusing on this in next February. And so of all of the things that we've looked at, that'll be the first thing that we put some really focused resource into. But it isn't by any means the only thing. You know, we've got to work with partners like the DWP and others to make sure that all of those people who are very disadvantaged get some wraparound service. So that's why I'm optimistic about neighbourhood health and the James Williams Health Centre, because I think that gives us an opportunity to do that, actually, to co-locate some of the things that people need other than health services to really kickstart them. And you've spoken to me about your interest in working on men's mental health as part of this. And absolutely, we're you know, very, very keen to hear from people about the way that we can use the Marmot status to do things. Our team went up to the National Health Equity Conference last week. I'm looking forward to hearing what they learned from there and some of the things that come out of that. And it's opened up a new kind of stream for us of different ways of looking at things, in addition to all of the things that we've been doing about health inequality. And yeah, Sir Michael doesn't hold back. He chairs our steering group, he holds us to account, and he'll continue to do that, which is a really good thing. And absolutely, you're right about what he's had to say about austerity. Anyone who reads his work can be left in no doubt about the damage that it did.
Thank you very much, Thank you, Councillor Shocker. Councillor Jackson.
Thank you, Chair. I just wanted to say as well, thank you for raising awareness of baby loss. I lost a baby when I was very young and it wasn't talked about, as we said. And then I went on to be sterilised 2 months later. So I just never, so I know not talking about it was added to the healing process. But I went on to adopt children and become a carer, which is my next lead on. It was really great to see that 276 carers assessments were done. They really are a lifeline to some carers having these assessments done. And it's nice to see that you're actually listening to carers in the help and support that they want, rather than what's just available to them. And like Smith has said, it's about the communication is a long thing. But are we, what are we doing to reach the carers that are most vulnerable, are either proud or are so involved in what's going on between them four walls, they're not reaching out and signposting. And signposting in my next one, I was at ward surgery. I had a lovely regular come in to me to tell me that he had been to a kindy exhibition, like you said, about all that was on to offer. And he was saying that it was quite poorly attended, but he's told lots of people about it, and they were then pressurising me to contact them to do another one. So I think it's just about that signposting and communication as well. That's...
Thank you, Sharon, and I'm sorry for the loss that you suffered, and grateful for the work that you've done in adoption and fostering over the years in Medway. So you've got a really personal perspective. One of the things that we don't do, Sharon, is touch the sides. We do work with a lot of carers, but we know there are thousands more out there who don't come anywhere near the council, and we're doing lots of things to try to think about it. We're hoping to introduce the carer's passport to give people reduced and sometimes free access to things. We're working with Trussell, who are doing a big project on unpaid carers, and just trying to, through things like the welfare and benefits team, for example, be a warm, friendly face of help in the council, as opposed to, you know, perhaps an image where if you got involved somehow something bad would happen. I'm particularly concerned that women are incredibly disadvantaged as unpaid carers. They often give up their job because they just don't think that there's any help for them. They've still got a right to assessments in their own right. Very few people actually take those up. We do have drives, and there are things on the website, but we could definitely do more. I think it's a balance, because there are some people who just don't want to be identified. That they've taken a decision in their life about what they're doing, and they're coping, and they don't want to be identified. But things change. You can be looking after somebody for a long time, and suddenly the situation changes, and it means that you need more help. So I think we've got to be open to that. We're working with Carers First. We've got a Carers Partnership Board that I attend, and we think all the time about more we can do. Carers First had a great session this year. It was held at All Saints, down there at the bottom of Magpie Hall Road, and was much better attended than when we held it in the Corn Exchange. So that was a bit of learning, that people could come along. And as you all know, and other carers in the room will know, making time for carers to do things for themselves and actually get out to something without the person that they're being cared for is a stretch. So I think we could do more online. We could do more to create an online community for carers to get that mutual support, although, you know, people do support each other, and I've attended groups where they, you know, do meet and support each other and talk. But it's another area where we need to do more. There are services available. There are, you know, little respite services. There are things that you can get to the carer that other people can't, to recognise the work that you do, and always got to think about the fact that they save us as a community a lot of money, lovingly, willingly, but often in the context of making a big sacrifice themselves. So I'm not at all complacent about that. I'm absolutely clear that we need to do more, and we're kind of in the process of having a look at that and making it a priority for this year.
Thank you, Councillor Murray. Just very briefly, Councillor.
Great. I was just going to say, Carers First were brilliant for me, but I only found them because someone said to me, do you want to go on a first aid course? And it was about empowering me as a carer, and I didn't really know that I needed the support until I went there and then connected with everybody else, and then they signposted me. So
I think that's a common experience, that people say, I didn't know I needed the support until I went there and thought about getting it. And yeah, that's really important.
It's definitely a common experience. It's something we should learn from, really, about that, the signposting to the right agencies. Councillor Goldwyn.
Thank you, Chair. And I've only got one question, you'll be pleased to know, Teresa. But just a quick comment about baby loss. And I must say how brave colleagues were opposite in mentioning their own case. But I think that brings a powerful message when we bring our own life stories. Pat and I have been really blessed. We have got 4 grandchildren. We now have 3 great-grandchildren and a 4th great-grandchild on the way. And I was sitting here just thinking about baby loss, how fortunate Pat, and if we'd lost any of those, Pat and I would have been absolutely devastated. So could I put in a plea, not just for the parents, who, yes, have to be the real focus, but don't forget grandparents and great-grandparents as well, because there's a greater family involved on that. That's just a little aside. Thank you very much for the report, Teresa, which I must say, there's a lot of really good stuff in there, and I'm quite happy to say that. And I'm also happy to support in principle that we need more care home spaces here in Medway. Indeed, David Brake and I, before the election, were doing exploratory work on to see how we could increase that capacity here in Medway. So, Trey, I'm interested to understand your reasoning in going for the option you have, because undoubtedly a partnership with the private sector or working with a strategic partner like Norse or a LATCO would be a much more cost-effective option. And given that finances are very, very tight at the moment, you know, we need to find the best value we possibly can on behalf of our council taxpayers and residents. So why are you doing it the way you are planning to do it and not looked at those more cost-effective options? Thank you.
Councillor Murray, if we can keep it quite succinct, because it's also in the council papers for Thursday as well.
I was going to mention that, Dan. First of all, congratulations, you and Pat, dynasty, you're lucky. And as you say, when you're in a situation like that as a parent and grandparent, you absolutely count your blessings and think about what it would be like if that hadn't been possible. We want to disrupt the market. We want to be a gold standard market leader. We want to offer training. And the model that we settle on may not be the model that the care home runs on forever. But I think if we don't take control from the start, given the level of borrowing that we're having to enter into, then we risk not achieving the things that we set out to achieve. So I accept that it's a bold step, but given the state of the market and the difficulty that lots of providers are in, what we're also trying to do with Care for Medway is protect the council from the situation that can occur when other care providers fail. And these days, that is a far more prescient and difficult situation in terms of risk than it probably was 5 or 10 years ago, simply because of the numbers involved. So we'll see. And you'll have option 4 in the paper for full council is the one that we're going for. And I look forward to a good and interesting debate about it.
Thank you, Councillor Murray. Thank you, Councillor Albin. Councillor Wildy.
I have 4 questions, but I'll try to be quick with all of them.
Very succinct, please, Councillor Wildy.
Life expectancy was mentioned. Now, I'm sorry, but life expectancy has risen, as far as I'm aware, between 2000, when the Conservatives had the administration, to 2024.
Is this a question to Councillor Murray?
Yes, it
Councillor
is.
Wildy, or are you correct in what someone said?
It gets to a question. This year in the paper somewhere it says ladies' life expectancy has dropped slightly. Do we know why? On the care homes, does Councillor Murray remember we had visits around the care homes when we had them in the past? The rooms were too small and didn't meet standards, so all had to be enlarged. There was no ensuite facilities. There was 2 bathrooms in the corridor for 10 bedrooms, if I remember correctly. The people could be showered once a week. And a staff member said but we don't need en suites because most of them use bedpans. And when the question is a serious question, and you sort of alluded to it just now, when that home was built, that was a very good standard of home for its day. Was sold because it's past its best. But moving on, we're going to spend lots of money, which is fine, but over 50 years paying it back, well, that's going to be out of date by the end of 50 years, definitely. Have you got contingency plans for when it's out of date, 5 years, 10 years, and we'll need updating? Even if it does still meet the standards, it will need updating continuously because these places do. As an aside, I'd like to say I'm very pleased that your originally discussed 40-bed scheme is now larger, as I thought was better at the time. Changing subject completely, on adult social care, do you know the percentage
Councillor Murray, do you want to
of
answer that
locums?
question? Sorry, hang on.
I was
just
trying
one.
to be brief.
No,
But
yeah,
that's
but
fine.
you've just said a load there. Councillor Murray, do you want to just comment on those couple of comments first, and I'll let David Wildey finish?
We could have kept the care homes and modernised them, of course. Yes, absolutely, we will bake in the need to have a proper programme of refurbishment and a budget associated with that, because for many of the council buildings that's been absent, and of course it ends up costing more in the end if you do nothing through the lifetime of a facility. So we will certainly be doing that. You're right, modern expectations have changed, thank goodness. So the kinds of things that you and I expect from our home will be in that care home, because the care home is home to the people who live there. And I want them to have the same things that you and I enjoy safely as much as they can. So the short answer is yes, doing it will be challenging, but we're absolutely determined it's going to be glorious, Councillor Wildey. You'll want to move in yourself when you see what it's like.
Councillor Wildey, do you want to finish your next one?
Sorry, the safeguarding question, do you know why women's life expectancy has dropped this year?
Well, this is the first time that life expectancy has dropped for about 200 years. And I think that we can all take responsibility for that. It's quite a startling statistic. In fact, Sir Michael Marmot has been very clear on saying that that is something that we should all be absolutely ashamed of. I think, for myself, I think it's there are lots of reasons, technical reasons. There's an effect of COVID, of course, where some people have had long COVID, and that has made them ill. And lots more people died than would have done under normal circumstances. So that's had an effect. Poverty shortens life. Councillor Wildey, we've got to try and lift as many people out of that as possible. And actually, so does inactivity. So we've got to keep people going and provide as many activities, preferably free of charge or at very low cost, to make that happen. It's not something, as a woman, that I want to see. I expect to live quite a long time and continue to come along here and answer your questions. So I'm sure that you've got the same wishes as me. Thank you.
I just hope I'm here to ask the questions.
We're talking 50 years, Councillor Wildey. Have you done?
The other two are quick. Adult social care, do you know the percentage of locums? And the other one I've lost, so I'll finish with that one.
Jackie, you can give probably a short answer to that. What is good is that it's going down and that we're seeing more people step forward for a permanent job, which I'm very pleased at. Slow going, though, slow going.
That was the main focus of the question. So if Jackie hasn't got the figures with her, whatever, that's fine.
So we'll get the details through for you to look at.
Yeah, that's fine.
Thank you. Just a couple from me. Thank you, Member. Just a couple from me, Councillor Murray. I suppose
Thank you.
I know you do watch these committees quite regularly, and you would have seen that I suppose our ongoing relationship with the ICB and KMPT and MFT, etc. They're robust comms we have with the teams. Sometimes, including with the ICB, sometimes fireworks, and sometimes just lately more colourful, hopefully without all the fireworks. Can I just ask how your relationship is with those main partners? Because obviously it's really key for all of us to work together. And I'm just interested on how because there are changes obviously in the ICB as well. I'm just seeing how you're navigating that as a cabinet member.
First of all, you're absolutely right to have put the challenges that you've put to all of those bodies. That's what Scrutiny is for, and you're working on behalf of our community to make sure they get the best service they can. And I always enjoy watching the committee back, and in some ways miss the days that I was on Scrutiny, actually. Look, my relationships are robust. There are people here tonight who will have experienced uncomfortable questioning, but I think one of the things that Vince and I try to do as a leadership team is agree to disagree as cordially as possible and focus on, and I hope I've done this with the Health and Wellbeing Board too, and change that from a sort of quasi-scrutiny to a working body where we think about how we can work together to make a difference to the problems that we're faced with. And I suppose that's my mantra. I won't shrink from saying when I'm unhappy, but I will always try to work together to make things better. I've had my knockbacks and disappointments along with everybody else, but that's part of the cut and thrust of working together. And I think for me, I am faithful to it being an integrated care board, not an NHS board that pushes everybody else around, an integrated care board where we're equal partners with skin in the game for making things as good as they can be. And I'm very proud, actually, of the way that our staff have taken that on and will go into any meeting with Medway in mind and not hold back if we're not happy about the way that we're being treated or the share of the cake that we're getting.
Thanks, Councillor. Only a couple more you'll be pleased to know. The other one was touching on from Councillor Hamadishi and others. Mental health is often mentioned and the struggle, the reduction in funding. We've seen the KMPT. We are going to call them in, by the way, for members. Just, you know, we will call KMPT in because of their CQC result, especially in the light of just recently us being told that they'd be a great provider for a contract that you would have seen just recently. What can we do to really change, Teresa, that it's already been asked about that partnership working, and I know we're doing some good stuff on the ground and with the police as well and others, but you know that 178% rise, you know, is just the tip of the iceberg, I think, compared to what we really need to do out there. Do you have a vision? I'm not, you know, it's not about just you creating something now, but we all would like to see it in a much better place. How far are we away from that?
We're a long way, but what we can't do is throw up our hands and have a council of despair, I'm afraid. We've got to keep on working, and we've got to send a message to those people who are suffering frail mental health that we're prepared to help, and that the causal things in life, like financial challenge, bereavement, relationship breakups, are part of the cycle of life that can impact the way you feel and the things that you do, but are recoverable from. And I think it's particularly important to send positive messages to young people. I think part of the problem, actually, if you were 16 or 18 or just leaving university, is that there is a really corrosive narrative around that AI is going to take your job, that you won't be able to get anywhere to live, that you'll be living with your mum and dad until you're 47, that it won't be possible to do the things that you want to do and go to the places that you want to go to. We've got to change that. We've got to show that there's a practical reality in changing it, and we've got to be faithful and credible in terms of giving those young people hope. They are our future. So I can understand, you know, if you're hearing that narrative and you're sitting in your room or sitting in the lounge and up pops a nasty message on Facebook from somebody who's trying to make things bad for you. That's not where I want anybody to be. And I think that's on all of us, actually, to acknowledge that that's the way things are and do our best to say that things can change. The trouble with experience, Dan, is that it takes too long to acquire. You know, when you've been through a few knocks and bangs in life, you know that you can come out the other side, but you don't know that when you're 16 or 18. And allowing people to spiral into despair just isn't what we should be doing. So, yes, mental health services can be better, but so can all of us too.
Thanks, Teresa. My last one is just, well, I won't mention Debenhams. My last one is about, obviously, we all miss James Williams. That's clear, and I think that gap will always, you know, that space at this table is always here for him, and we can always still feel, I can always feel that look he used to give me at times. The James Williams Health and Living Centre is really exciting, right? I think it's really exciting. Do you think it will be realised as a model that we could use, that could be recognised by the ICB and others to roll out across deprived areas and stuff? Because it's going to be such a good, it's such a good model of working, and we're looking at neighbourhood healthy areas, aren't we, and stuff like that. Do you reckon it could be a really good legacy if we do it, if it's done right and if it's supported correctly by partner agencies and statutory agencies?
We have had a bit of extra money in for neighbourhood health and for developing it. And we did put in an application to be in the vanguard, the first 40 neighbourhood health centres, and were not successful. The applications that favoured frailty were the ones that, generally speaking, were successful. And, of course, in Medway, we've got different problems. A lot of our problems are the ones that I was talking about before: health inequality, younger people getting chronic disease at a much earlier age, and living in very complex situations with lots and lots of different things going on that are leading to them being poorly, including those wider determinants that we're responsible for, like housing and jobs and all of those things. So I'm very optimistic that it can be a good model of how we want to work in the future, because the building is capable of doing that. And in part, although we've got some great estate, actually, it's not as well managed or as well utilised as it could be. And I think we're starting with a blank page of making sure that poor utilisation doesn't happen. I also think the location is helpful. You know, I'm really pleased about that. It took a long time, and there are people in the previous administration, you know, I don't deny that at all, who wanted it to happen. But what we've been able to do is drive it forward and have a real stake in how the building's going to look and feel. And I think people will be pleased and surprised about that. And I'm hoping that it will do its work in sort of lifting people up, because there'll be lots of different activities going on there. And yeah, it's great to have named it after James, who saw this. But, you know, he left a fantastic legacy and a great team who won't let him down. So I'm looking forward to it.
Thank you so much. Thank you, Councillor Murray. Thank you for your time this evening. It's been really helpful. Vice Chair.
I move that the committee note the report for the Deputy Leader and thank her for attendance at this evening's meeting. The committee recommends that a video is produced to reflect a day in the life of a social worker, and also that continued training is developed for working between nurses and social workers. And something about the briefing paper?
We've got some, Terry, have you got the briefing papers down? We've got them down, the
right,
briefing papers as well that we asked for. Yeah. Thank you very much. Is that seconded? Is that agreed, members? Agreed. I'm going to ask MFT to come up to the table, and I'm going to have a quick 5-minute break. Thank you. Okay, we now move to item 6, which is the update from MFT, a Medway Foundation Trust. Would you like to all introduce yourselves, please? Thank you.
Everyone. Oh, sorry.
Just your microphone, yeah. Put it towards you, John. Thank you.
Good evening, everyone. John Gulston, I'm the chair of the Trust.
Good evening, everybody. My name is Siobhan Callan. I'm the Interim Deputy Chief Exec.
And I'm Graham Wild. I'm the Interim Executive Director of Recovery.
And if I could just add, apologies from John Wade. He's on annual leave.
Thank you, John. I don't know if you want to give a quick highlight. I mean, I just will give you some comments. There has been some comments around not enough detail really in the report for both of the issues. We can deal with that hopefully with some of the questions and maybe a briefing paper afterwards. And also about lumping them together because they're two really, and I definitely know from talking to you, John and Siobhan, they are two very important issues, and I don't think by lumping them together was just trying to dissolve them into one because we know they're really important. But is there anything you want to just highlight briefly before I go to members?
Yeah, if I could take the opportunity just to say absolutely the first thing around the culture report, we were really disappointed with what we read in the report. But it chimed with what we've been hearing in our staff survey and what we were hearing through our grievances. So it was beholden on us really to respond to that in the most robust way. So we've accepted all the recommendations from the review, plus we've added a sixth one, which is around gender-wise. And we've kick-started the work. We've got executive leads. We've also got our non-executive directors of the organisation linked into those work streams. And we've also got a number of our governors linking into that as well to make sure that we're addressing all of the issues within the report, which are multiple. I think it's fair to say we've shared it with our staff as well. I think they've appreciated that openness that we've shared it and that we're saying we want to put this right. A key part of our staff survey this year is making sure that we still hear that. It hasn't all come out. I think there's lots more for people to say. And the first part of the first work stream there is around building trust, and that's the one that I'm the lead for as an exec. And it's very, very important to me that we hear the staff voice. If we don't hear the staff voice, and if we don't listen to the staff voice, then we're not going to give good patient care. For me, having happy staff who are well looked after in the workplace, who are invested in not just professional training, but in terms of understanding what they're living with and the challenges that they're living with and what they bring to work, but also being able to bring their best self to work, whatever that might be. And that for me is the key thing. And that for me is also the reason why Medway has such long-term issues, because the culture is not right. And until we change the culture, we can do whatever we like in finance and waiting lists, but we're not going to make a difference unless we change the hearts and minds of the people who work there. So that for me is my commitment to our culture. It's not a quick win. And yes, we do have a roadmap. We do have timelines linked to that, but we know this is a long haul thing that we need to do. What I am encouraged with is what I've heard since I've been here, is that people want to be a part of that. They want to make that change. They're not satisfied with what it is. They want to have their voices heard. They live locally. They want to make changes for their local hospitals. So there is a passion and commitment. We need to tap into that and be able to release that, but be prepared to hear more, because I don't think it's all out yet. So that's me being very honest with where we are. We have a long journey ahead of us. And part of that is addressing some of our other issues within the organisation as well.
Thank you. And before I hand over to members, I think it's just, I just want to make it clear from a committee point of view, is that we've always supported the hospital with your challenges. We've also challenged you very heavily when those challenges have not been dealt with. I'm going to say that the cultural review, it was shocking, but it didn't surprise me because this committee's been seeing that since 2015 and before that. It isn't the first time, and no pressure on you because you're only just here, so please don't feel we're going to be just having a go, but I think you want to hear challenge. It isn't the first time a different CEO has come along and told us that it's going to change, and it never has. And, you know, I think, I'm going to open to members, I think we all agree, and I know you guys, you definitely do, that bullying, racism and discrimination shouldn't exist anywhere, including in the hospital for staff or the patients or anybody. It's just not good enough, and it is an appalling report. Members. Councillor Hamadisha.
Thank you very much for the report. I find it very, very disheartening that we're still talking about, you know, changes and around culture and how we treat people with respect and dignity in 2025. I understand it's going to be a challenge for your organisation because the backdrop that we have in the UK at the moment is one where it doesn't support diversity for some strange reason. So I want to put some context. Everybody in this room, as a clinician, I can say this, irrespective of your political affiliation, your banners, you're all minorities to me. The ultimate minority is yourself, because when you're receiving treatment in a hospital, you don't want to be treated like anybody else. You want to be treated as an individual. And as long as we understand that, we should be able to enable our staff to work in an environment that protects them, allows them to be who they are, so that they can take care of us. And so, as if anything, I would be looking for a plan, not just a long journey. A journey without a destination is just a journey. A clear how many point plan to create that environment with clear checkpoints that is measurable, maybe not even achievable, but aspirational. Because I've sat here now long enough to know and heard enough talk about we've listened. Listening is not even the issue. It's acknowledging. Yeah? Listening means nothing. It's can you acknowledge what's being said in front of you, and do you have the fortitude to change and make that difference, irrespective of the noise or lack of support you're going to get from certain people across the chamber. So my point to you is, have you got a plan in place? What does it look like, and how many points and checkpoints are in that plan?
Yes, we do have a plan in place. And we've also made culture part of our organisation's stabilisation plan going forward for the next 18 months in terms of deliverables. So as I said, we've got 6 work streams. Each of those have key performance indicators. So if we're looking at listening events, when those listening events are, how many people we've trained to be able to undertake those listening events, looking at the outcomes we're getting from that, and then what we are doing with that. It needs to link into our RES and DES, which are our disability and our work-related equality statistics. It also needs to feed into our staff survey, the outcomes from our staff survey as well. So it's linking all of those things in. We've got training going on for middle managers about how to manage staff compassionately. We will use a lot of staff stories to help with the education. It's all very well going on, doing mandatory training online and ticking the box and saying, yeah, I've read that and I can tick that multiple choice question. But actually hearing somebody's lived experience about what they've experienced around racism or sexism or because of your religious or diversity is really much more powerful story. As we've heard here tonight about baby loss, the impact of hearing someone's story is a way of levelling us all and making us all treat each other with respect. But we have to give people the space to tell those stories. I can't bring a horse to water, make him drink it, but I can certainly make sure that we create the right atmosphere and opportunities for staff to be able to do that. But it's important that then we feed back to the staff and said, you know, you said, we did, as simple as that. But until we start to feel it in the organisation, such as, you know, the number of grievances, the number of HR employment relation cases that we have in the organisation, making sure we're looking at those employment cases. Are they more heavily weighted towards a particular area in EDI? Because this isn't just about race, this is around equity across all of our staff groups. So making sure that all of our processes are linked into that. This isn't something that we see in one little, shall I say, silo. This is about our whole organisation. So everything we approach must have our culture review woven into it. It can't be seen as a project with just a timeline that we report into People Committee. It has to be how we do business at Medway, how we treat each other. And equally, we need to also be challenging our community about how they treat our staff, because the level of violence and aggression and racism is beyond anything I've ever experienced in any other trust. So our staff put up with quite a lot. So it's about giving them the skills as well to be able to de-escalate. But more importantly, it's about when you come to work, are you treated well? Is the environment you work in safe in all physical as well as an emotional and well-being sense? So yeah, listening, making sure that we're telling people what we've done, what we're doing, bringing in a Freedom Speak Up Guardian. We brought in an external service so our staff could trust that. That's really important. Making sure that our staff are a part of those work streams, that they're leading it, that we're asking them, how do you want those listening events to take place? Where do you want them to be? Do you want them to be online? Do you want them to be individual in groups? We don't know what's best. Our staff do. So when they talk to us, we need to be listening and then putting that into action. Our non-exec directors are very clear about holding us to account around this, as are external bodies like NHS and the ICS as well.
Councillor Duché.
Yes, very quick. Thank you. Thank you for that. Just regarding the risk that you mentioned, this reporting, is it going to appear on the risk register so it's discussed at CEO level each time?
Absolutely. It's going direct to board. So it'll go through the subcommittees of the board, but it will be included in our board update. And we also have board development days, which include diversity training in that. All the boards and the trust leadership team, which are divisional people who run the hospital, have all undertaken like an MOT around diversity, around their perceived attitudes, etc., so that we can target training and awareness around that.
Thank you. Thank you. Can I just remind members what I'm going to do to make it easier? We're going to talk about the culture review first, and then we're going to go on to the ENT part second. It makes it easier for. That doesn't mean we get double the time. It just means that so don't worry, you're not going to be here for 2 hours or an hour and a half. Well, you may do, but it makes it easy for actions and any reports or briefings we need. So I'm just going to concentrate on the cultural review first on your questions, please, if you're asking. Okay, Councillor Campbell.
Thank you, Chair. Yeah, that's really helpful, actually, splitting it up. Thank you. But I also wanted to say that, I mean, reading this report, it's a bit jaw-dropping when I read things like violence in the workplace, for example, and outright racism. I just can't understand how it got to this in our local hospital. It's my hospital. I gave birth to my child there, and I just think, how could it be like this? And you know, health is a universal need and it's a universal provision. How can there be racism within that? I know I sound a bit naive and idealistic now. My point is, it should not matter what people's background or culture or when they're providing healthcare services, because it's a universal need, and your healthcare need is your healthcare need, whatever your race or gender, ethnicity might be. And I'm really glad you brought an external agency to do this. And the other point I quickly wanted to make is, there's been this recent rise in this kind of very fashionable opinion that DEI, diversity, equity, and inclusion, is some kind of left-wing notion that is just used to push some kind of weak political agenda, you know, driven by a certain someone in America. And now people, lapdogs here in the UK, are happy to jump on that. And reading this report, this is why we need DEI. This is why we need it. okay? And these far-right parties, these far-right people, they will gut this society and this country from the inside if we give into conversations like this. So this report, to me, just makes me realize even more why we need to think of DEI in the workplace everywhere. Most of my points have been covered by Councillor Hammond-Dishe. I just have a sincere request to make for you. Culture change, the arc of culture change is very long and very wide. It takes time and it runs deep, okay? This is a once-in-a-generation chance you have to try and shift this, something that will impact, you know, a long way down into the future. It'll be so easy to have a few committees and steering groups and subcommittees, a press release here or there, a couple of nice stories, but please, please, please don't give in to the temptation for easy, quick fixes or something that looks good, something that's glossy. Please dig deep on this. Please really go right to the heart of the matter and deliver something, because ultimately, if people are going to work in environments like that, they can't deliver effective healthcare to our most vulnerable people who go into that hospital, right? So this is pretty critical. So I implore you to dig deep and not to take easy solutions around this. Thank you.
Thank you, Councillor Campbell. Councillor Shocker.
Yeah, I think the two councillors before me just hit on everything I was going to say pretty much. Obviously, institutional racism exists in a wide range of institutions across the country, and we all witness that. And this report lays that out as well. I think if there's anything I probably may want to cover is how was this, from your insights, how was this behaviour allowed to be tolerated from the information you've gathered so far up until now? What was it that, you know, made it in, an environment like that? And what kind of concrete metrics and oversights are you going to put in place for that to not happen again?
So I think it's a combination of two things. I think it's a combination of previous leadership not taking this seriously enough in terms of it being an endemic problem and seeing it as a problem in certain areas, as opposed to a problem that actually is very deep-seated. And I think that it therefore needs and has had a very different approach from the leadership. Secondly, we're not being good at developing our middle managers, and we have in 5,000 staff and about 700 or 800 middle managers. And I think that have we given them the right skills, and do they have the right experience in order to deal with these things properly? And I think we haven't helped them, and we need to help them. It's not easy. You know, a lot of our managers are nurses. They become a manager, or a different profession, and they become a manager, and we don't necessarily, I don't think we have a track record in the NHS of supporting our middle managers in the right way and developing them. And this is a hard thing for them to deal with, and we need to support them better.
Councillor Shocker, is that okay?
Sorry, there are a lot of metrics. Yes, the answer is yes. We've got, first of all, we have the annual staff survey has particular metrics on EDI, so we can, you know, bullying, harassment, etc. So obviously we look at that. We're in the current, at the current time of year, the survey runs to the 28th of November. We'll get the next results. So basically it's every late summer or early autumn. The survey takes place. We get the results in March next year. So we'll see what the differences are, that gives us what our annual review of where we are in effect on EDI. But we'll have our own metrics as well to guide us along here.
Yeah, we have a pulse survey, which is run nationally, but it's our results. And I think they're quarterly, so we'll be able to keep an eye on things. But most importantly, we just need to keep going back to the staff and asking them, is it feeling better? Are you seeing it? And that's around using our staff who are involved in our EDI networks to make sure, because they're going out into areas and doing that listening. Plus we have incivility huddles, so we go into areas where we've had reports of incivility, and we do some improvement work with those teams, and they're about how how to speak up, how to speak out, how to speak up respectfully, but how to be, you have to be brave, and helping people to be brave to say, you said something, I'm not sure that came across the right way. Did you realise how this landed in the room? Sometimes it's bringing people's attention to something that they didn't intentionally mean, but actually it's come across because you're not sighted on what someone else has been through. You're not aware that someone else, we call it weathering, don't we, where someone has had lots of experience of being racist against, and suddenly somebody says something and it's kind of, oh, why did that land so badly? Don't know what you mean, it was just a joke. But actually, you don't know what that person has been through. And so it's around helping our staff to be able to have those conversations and understand. And when, John spoke about middle managers, when we're teaching our middle managers how to manage staff, to be able to hear those things, but to be able to know where to get support and offer, we're not expecting our managers to be expert in managing, everybody's needs, but to be able to redirect in the organisation, support, what can we do to help, what can we offer differently, and being cited that, yes, and I would agree, everybody is an individual and everybody should be respected as that individual. The NHS welcomed me 40 years ago from Ireland, and I've worked in a multicultural NHS, so for me this report was very shocking. And the diversity, you can see we've got a poster up at Medway, we've got the diversity of flags from around the world that help deliver healthcare to our community. And just like our community, we need to respect our colleagues.
Thank you, Councillor. Councillor Wiley.
Thank you. I'm not quite sure where to start, but as Councillor MacDonald said earlier, we've been hearing about different NHS institutions having that bullying culture, then it goes away for a couple of years, then it comes back. And it does seem to be a cycle in almost all of the NHS labelled bodies that we see. So I really do find that disheartening, but that's more of a comment. Some of the comments about diversity, etc., reading that report, it didn't come across that that everybody was bullied or felt bullied because of their diversity, but because of who they were, what they were doing, or even if they were the perfect nurse, cleaner, whatever, the person above them just bullied whoever it happened to be. There were comments from, well, it seemed to me, a cross-section of people, and it didn't seem a culture, it did seem, as I think one of you said, almost individual. It just seemed so inbuilt that people seem to think, that's the way to behave. So, yes, I understand your problem to change it, but it just seems very difficult to me that you can go out, be in the normal world, and, if you behave in certain ways, you're going to be in trouble. I don't see how you can go to work, especially in the NHS, and think it's acceptable. It's the only thing I could think that might cause it is patients in A&E, because I've seen lots of patients in A&E over the last few years, and the way they treat staff. I can understand staff might get stressed and that might come out, but this did seem, not just in A&E, they're high stressful places, but everywhere. How can we be assured that when we get a report in a year, 18 months' time, that everything's hunky-dory, that you haven't just found a way to hide it? And the other thing I would ask for, you said there was a 3-month report or whatever, or on, sorry, I've lost it now. I think it's 6.4. You mentioned that there's going to be regular updates. Well, could this committee see those updates or a version of them I don't know how frequently you would want
Councillor
them.
Wilde, yeah.
but-
So
yeah.
just to answer it, saving your time here, I mean, obviously the interim CEO will be back here very shortly because we haven't seen him properly here and he needs to come and see the committee anyway to answer this. We've got also the other plans coming out about the future plan around the other hospital and how they're joining up and how the two might join. So, but we will definitely be calling this back and it won't be 18 months, it's going to be a lot sooner than that they'll be coming back and telling us what's going on. John?
The thing I'd just like to add is every other month we have our board meeting in public, and this goes through our board meeting in public. All our board papers, in the same way this is live streamed, we live stream our meeting. It's on our website every month. You're all welcome to listen, all welcome to obviously the meetings, the papers are all in public. This paper is on our website. It's there for the public to read. So every 2 months we will have an update on this because it's part of our stabilisation plan and the work that we need to do. You're welcome if you would like us to give you a summary of that.
You will be definitely back, John, yeah. You will be definitely
But what I'm saying is we may not come back for a few months, but on a live basis, we will be looking at this at our board meetings in public every other month, and you can see the progress or the lack of progress on that and take it from there.
David, has that answered your question?
Yeah, that's fine.
Okay.
Thank
Councillor
you.
Goldwyn.
Thank you, Chair. And I've had quite a lot of experience at Medway Hospital over the last couple of years. Some of the treatment I've had, I've got to say, has been absolutely brilliant, first class. But at the other end of the scale, there was an incident that was appalling, and I had to the only time I put counsellor on a letter and used that because I didn't want anybody else to have the treatment that I had. Having said that, as individual staff members, I've had some really wonderful, caring, professional people treat me. But there is an underlying tension there. And I'll be quite frank, I'm probably going to get myself into trouble now. But there was a definite frisson between Nigerian staff and Filipino staff. I got that in more than one occasion. And we'd have to say that the hospital is a United Nations. And we've got people there from every corner of the world, and the vast majority of them are doing an absolutely brilliant job. And, you know, we should be proud of them. And those who try to say that immigrants have got nothing to offer our society, they should go to the hospital, because the hospital would not run without those people. And
thank you, Councillor Goldwyn.
Just saying, you know, absolutely firmly. And it is a United Nations, and the majority do seem to get together, but there is that tension. And also, you mentioned the issue of management training. I think it's not just the health service and the public sector, but it goes into private industry as well. Our management training in this country has been appalling. Just because you're a good doctor, a good nurse, a good engineer, chemist, physicist, doesn't make you a good manager. It's a completely different skill set. And, you know, that skill set has to be learned. And it takes time and it takes money to develop the people on. But we just assume because somebody is good at their job, keen, they can go up the ladder. But so often they go up the ladder and virtually fall off it because they're put into quite unfairly put into a situation that they can no longer cope with. And I've also got some comments to come about ENT because I had a personal experience
We'll come back to
with
ENT.
that as well.
We'll come
so
back to
we'll
ENT.
leave that for later. But so what, you know, I just want to be assured that the situations that I went through and other patients went through when I was having my prostate removed won't happen again. And what are you doing to change the, the training. And also the other thing I spotted, there isn't a best practice, as far as I could see, way of doing things. Certainly, I know it's very bureaucratic and it takes a lot of effort, but schemes like ISO 2000, where you have to work within an organised framework, and every consultant and every doctor who wants to do things differently is told, well, that's the best practice and that's the way you do it. Because that's the other thing that happens, that I think the staff are getting confused because one consultant says one thing and then another consultant comes back and says another. You've not sorted that best practice issue out. But so I'd like some reassurance, what is in the plan to try and improve that, please?
Can I just ask, though, thank you, Councillor Garvin, I would rather you don't comment on the specific group of people that Councillor Garvin was mentioning.
Absolutely.
Because I'm sure you may know about certain elements that are going on, but the question around the governance part would be good from what Councillor Garvin asked.
Yeah, so I think just to talk about best practice, so there is a national programme called GIRTH programme, Getting It Right First Time, and it's led by a series of expert consultants within their field, orthopaedics, ENT, gastroenterology, whatever, and they produce what is the best practice for very many of our conditions. And all of our directorates are working to that, and we're holding them to account for that. So they've all been benchmarked against GIRTH to where we are, what we're doing. So if we're doing hip replacements, are we all doing hip replacements the same way? Are we all using the same prosthesis, the same cement? Are we all using the same technique? And then we look at our outcomes to make sure where we are. So we've got a couple of experts within the organisation on that. I'm pleased to say we've been part of the National GIRTH programme. So our Chief Medical Officer, Alison Davis, has been a part of that. And we've now got Jeremy Davis, who's one of our ENT consultants, who's also part of the national programme. So they bring back that expertise to the organisation. And we've very much made that embedded within our stabilisation plan for this year to look at our patient outcomes. Are we working to best practice? If not, what we need to do to get there, what we need to do to be able to deliver that. So
thank you for that. Thank you. I've got Councillor Name.
Thank you. Thank you, Chair. Well, with the report, you did say that you are coming up with actions to address the issue of discrimination and related issues. Now, how will you ensure that they are effectively enforced and not just policy on papers? Because most of the time, people will come up and say, oh, we are coming up with policies and to solve the issue. But at the end of the day, have those policies or those measures, have they been tested within any other organization? And that you've seen results that, okay, when this NHS adopted this measure, results came which were very effective, that when you apply to yours, it might help you to achieve an end goal. Then I would like to also, if you can answer, how diverse is the management team at the NHS in Medway? How diverse is the team? And how are you supporting career progression for BAME? Because in section 4.3, you said lack of fairness, accountability, and barriers to career progression, particularly for colleagues from Black and Asian and other minority ethnic groups. So how are you going to encourage those people so that they can progress within the NHS in Medway?
Yes,
thank you.
I can address the policy one first. So what our interim chief people officer, who's very experienced, has identified within the policies that they were kind of all lumped together and weren't very clear. So what she's done, rather than just redo our policies themselves, is to do it as part of the system. So working with other CPOs from the Kent and Medway system to make sure that we're developing our policies as one. So we're looking at the best practice and then following that, and that's what will be brought back into the organisation. And how we look at that and look at who's been through those procedures to make sure that there's no bias within there. So we've got some external verification on that. We've got somebody from another trust coming to look at our employment issues log to see whether we're out of sync, whether anybody was treated unfairly, whether issues were brought unfairly, etc. And we're going to keep that as a regular issue. In terms of our EDI group, it's staff-led and supported by our staff experience team. We certainly need to kind of make sure that that diversity is embedded within all of our teams across the organisation. In terms of looking at leadership, so what we've identified is that, we have very capable people across all our staff groups and across all of our networks. And it's about making sure that they have the same access as everyone else, that it's transparent, that I don't promote somebody because they're my friend. I make sure that that job has got an up-to-date job description, that it's been advertised internally at the moment within the organisation, making sure that our interview panels are very well balanced as well. So offering the education and training is very well developed, I have to say. At Medway, we have a really good education department across all disciplines, but it's making sure that people are getting access to that. So looking at people who've had study leave, is that fair across all areas? Are our Band 2s and estates and facilities getting access to training? We know our doctors and nurses all get access to training, but what about our other staff groups? Are they getting there? And especially, somebody made reference to our middle managers and about management development. So less of a tick box around development, but making it more meaningful, and that's part of our appraisal process. Is this, so almost making sure everybody has like a career journey and helping them within that. So we've changed our appraisal paperwork to make sure it's really focused, that the conversation is around the individual and what they're adding to the organisation, rather than everybody fits in that pot or everybody fits in that pot. So making it fit for purpose to help us deliver what we need to deliver in terms of our strategy for them as well as for our patients.
Thank you very much for that. Thank you, Councillor Lang. Councillor Cook.
Yeah, thank you. I had a question while I was reading the report, and it's really come out tonight, about the fact that while we're addressing culture, it's not a standalone issue, that there are contextual challenges, that you've alluded to some of those tonight, that this work is placed within. And, just on sort of the 2 years or so I've been on this committee, we've heard some, that these are the same staff as we know that are dealing with the kind of behaviours that you explained, the issues with adult social care that Councillor Murray is really working so that people aren't stuck in hospital and can move on, the reality of people presenting late with diagnoses, with needing more staff, and the training that people have had as a result of that. And I'm so conscious that these are the same people that are working in this really difficult, complex environment. And what we know we can't do is stop the work and stop the pressures so we can change the culture, so we can go back in. We're having to still deal with all of that at the same time. So how are you managing to address the culture while still specifically working in such a challenging environment?
So primarily that's about asking our staff how they want us to do that with them. So we can have awareness events. So, we've got Black History Month and what we're doing. We can have lots of social events for staff as well. About sharing is a great thing. If you share food with somebody, it's a great way to get to know their culture and how they get on with things. So a lot of it is around the events that we put on around well-being and awareness. And we have to make time for our staff to be able to take part in those events. So releasing staff is really important. So supporting our trust leadership team with enabling those staff to attend an EDI event and making that a part of, this is about your well-being. We want you to go to this. Want you to develop that. And encouraging people to, because the more they take part, the more they'll be able to help and understand. And, there's a saying, we need to bring all the ships in the harbour up to the same level, not just one or the other. So for me, that's around that equity and making sure that that's visible, because a large part of the report is around, things happen over there and I don't know what's happened. So they will automatically, or some people will assume that's because of this or that's because of that. And so it is around making sure that what we do is transparent, that anyone can challenge us, which we have opened up, which I think is really, really important. I'm happy to, put myself out in an area and say, tell us what we're doing wrong. If we're doing it right, tell everybody else. If we're doing it wrong, tell us, because we can do something about it. So, but we have to then go back and feed back and say, okay, we invested, we did this, it didn't work, what do we do now? And be really honest, if we haven't got it right, say it. We don't need to gloss over it, and certainly you wouldn't allow us to do that. And I wouldn't come back here in 18 months and say everything's tickety-boo, because it won't be in 18 months. This is a longer journey than that. I might be able to come back and say these statistics are better, that staff survey is showing, you know, better. We've got lower sickness rate, we've got lower turnover, our recruitment is good, we're attracting a higher level of staff in terms of, you know, we've got people wanting to come here. That would be one of the really good metrics. Have we got a waiting list of people wanting to come and work at Medway? Because I know the staff feel absolutely passionate about working there. I mean, I've come from another organisation, but the stories that staff are telling me, some of the positive stuff, are really amazing. And we need to be sharing those good stories and saying, look, this is really good, this is what we had. You know, one of our paediatric consultants, one of our NICU consultants, has won BAME Female Leader of the Year. That's fantastic, that's really brilliant, the work that her and her team do at NICU. And she didn't say it was her, it was all about her team. You know, that's amazing. Let's share those stories. Let's share the positive things and say, okay, how do they get it right in there? What's good about that? And how can we replicate that in other areas? But it's celebrating the good, but don't gloss over the bad. Call it out, be transparent about it, and say we need to get in and find out what's going on.
Thank you. Just really quickly, Councillor.
Yeah, I think that's exactly what I was looking for around prioritising the important over the urgent, and the courage that I've heard from you, you know, to be able to do that, because it must be a very difficult challenge to be able to release staff in the now. But as you've said, the benefit of that, and huge congratulations to that member of staff as well. Thank you.
Thank you, Councillor Cook. Councillor Campbell, do you want to come back on a small
Yeah,
item?
just a small, kind of, I want to have a right of reply to something Councillor Wildey said. Correct me if I'm wrong, but I thought you were suggesting that the bullying is endemic across everybody, and it's not because of diversity. I think that's what I heard you say. I just wanted to clarify, you can have a culture of endemic bullying, but racism is a very distinct thing within that. If people are being discriminated or targeted in any way, then you have an institutional racism problem, and it's pretty important that we call that out and acknowledge that and address that, and not kind of sweep it under the general bullying umbrella. Thank you.
Thank you, Councillor.
May I? No, I accept what you're saying, but there was comments that people that were not a minority ethnicity were also feeling, but what I was saying was everybody there could be susceptible to being bullied, which is, yes.
Okay.
There can be different reasons for bullying.
Okay. Right. But we've got the cultural report in front of us there, and there are specific reasons in there we've seen. I mean, let's not let's not get into this.
No, it definitely does mention minorities,
okay.
and they felt. But
yeah.
I'm not diminishing that, but others are also being bullied. Or that's very my clear. Understanding.
Councillor Wildey, sorry, it's very clear. I just want to make it very clear here this evening. We're looking at a cultural report about those ethnic minorities and those hidden people within Medway Hospital that have felt bullied, abused, or not listened to. We're not talking about everybody in the hospital, and there probably is other people in the hospital, other staff members. We're talking about the culture. But I'm going to move on for this, because I just want to ask what Councillor Wildey, John, I'm going to ask you first, I think, is what Councillor Wildey would call a very awkward, one of those awkward questions. So you said to me about the previous leadership at the hospital. Okay, so you're talking about, when we talk about leadership, we're talking about the board, right the way down. We're not just talking about, you know, cultural understanding should be in every organisation. The hospital will not immune to it, right? So can you tell me, first of all, on your board, who was under the previous leadership, who has been removed from the board because of this failure?
So it's not quite like that, I would say. Hold on. We have a different set of executives today that we had to the set of executives that we had a year ago. And that's for a whole variety of reasons. One of the things that the work that we've done with the board, so we've done something called a diversity MOT. So every member of the board, executive and non-executive, looked at self-assessing themselves. The executive did it, the non-executive have also done that. We've got a lot of skills, actually, in our non-executives in terms of skills and experience in dealing with these problems. And we've got a very diverse non-executive team. I think what has shown is that with our executive team, they haven't necessarily had the skills and experience to really understand the depth of this challenge and what it's needed to take to deal with that. And I think with people like John, Siobhan, we've got a more how shall I put this, much more experienced executives who actually, I think, are able to understand this in a deeper way. And I think that that's going to make a big difference.
So just moving on from that then, John, because obviously you was chair on with the previous CEO. So am I right in saying that from a board level, you said 2 years ago, but this has been going on this has been happening right up until this come out. This hasn't just appeared. This has been going on for a long time. These failures and letting down staff with this cultural, which the culture review pulls out significantly, and we've spoken about it already tonight. So if we're looking down, I'm going to come down to lower management in a moment about have you done any disciplinary or leadership processes already because of this cultural review, because you need to. From a board level, no, there has been no change. I'm not being horrible to non-execs or to you execs, but an MOT means something to me, right? We're talking about a failure in a process in a business, in a hospital. And I class it as a business, we all pay into it, right? There's a failure there, but am I right in saying that no board members have left or been removed because of that failure at this moment in time?
What I'm saying is it's a part of the reason why we have a new set of executives today. This is an important...
But you said previous leadership, which is just not long ago. John's only just come in.
Yes.
So we're talking about previous leadership, which is even last year,
yes.
even 6 months ago.
So I joined the trust in June 24. And credit to the chief executive at the time, Jane, and I sat down with Jane, and based on early findings that I had from people coming to speak to me, I and Jane sat down and we agreed that we needed to do something much more significant than the trust has done before. And to be fair to Jane, it was Jane's idea to bring in the company that we did based on experience that they'd had elsewhere, and we started the review. But if you look from the period from 2005 onwards, January 2005 onwards, we only have one executive director who's still there from when I joined in June 24.
So I take it some of them board members are still there. I mean, I'm not going to harp on about it, but they're still there because this cultural, these things that have happened here have been going on right up until just recently. So going down the level then, has there been, I don't want to know about individuals, but specific disciplinary or leadership actions in the failures of the executive teams that are there now?
So if we've got any evidence of individuals, we will have managed that through our HR process, our employment relations process.
But have we? Have you?
Have we?
Have you dealt with any
because
specific?
We haven't got any. So we haven't got any specific within the group. Right. So no one has kind of said, okay, Siobhan bullied me or was racist against me on such and such a date. If we have had that, then we have taken action. We do have current outstanding grievances direct from staff, which are all being formally investigated. So, and that's the one I mentioned around where we've got some external support with that to make sure we've got external view on that. Because for a number of staff, they'd lost trust in some of our employment relations processes. So it's about building that trust for them as well. That's why we've gone external to get that more robust and to show them that kind of we mean business this time.
I mean, I'm not going to harp on about it because I think it's going to be, the proof is going to be what comes out from this. As far, you know, I still can't get it. It's exactly what Councillor Hamadish said right at the very start. When we say that the hospital they didn't have that cultural understanding at the top, doesn't make sense to me. because, you know, I worked in hospital as a nurse, be a clinician as well, so it doesn't make sense to me because there are so many different people from different parts of the world that all join together and do a great job. It doesn't make sense. Anyway, from me, I suppose we would want to see that there is that safe place for people to report. Your surveys have always been pretty poor in the past, not enough people coming into it. Hopefully you'll get that safe place. And the only other worry I had about is what you don't want to see, because it was all about the huddle. It was all about the huddle. When I come into the hospital, I was shown them boards of information in that top executive office on every wall about everything you're ticking off, right? This is about people, this one. And I know you get it, Sean, and you, John, but this is about people, right? And it's not just about a notice on a wall, is it? It's about a safe place and a safe place for people to come if they're feeling bullied or let down, or again, for our community are letting staff down. If they're doing that as well, we can't accept that sort of behaviour of people coming in from our community and treating people like the way they have, and it's just appalling. But I suppose what we want to see, and you know, we're not going to talk about it with the ICB, but the ICB have got a pretty shocking cultural report review coming out as well. So you're not the only people. But I suppose this panel would want to see the plan, because we've always talked about the plan, or we've always talked about we've got a focus and the plan and the way ahead. We never see it. So it'd be good, now you're getting into it, I know it's early days, now you're getting into it, it'd be good if we could see that plan, because it'd give us some, and without maybe, you know, going online and watching, because anyone watching anyone watching this one, John, after 4 hours will be turning off.
Sorry, Councillor. What I meant was that we're very happy to copy the reports to you every other month.
I was only jesting with you, John, about that, but I'm just saying it's not everyone's thing to do. But okay, but
we'll definitely provide the plan.
If we can see the plan, that would be really good, and I think that would be great. Okay, let's go on to the nearly 9,000 people let down with ENT. Who's going first on that one? Would you like to give, Graham, would you like to give a bit of an update on where we are with that?
Yeah,
please?
if I could start with that. But if you're, with your forbearance, Chair, can I just thank you for lighting the candle on Baby Loss Awareness Week. It was a key part of my role as an NHS hospital chaplain to support newly bereaved parents in the delivery suite. So it's quite poignant for me that you've marked that today and lit the candle. So thank you. Turning to ENT, on behalf of the Trust, we want to start by reiterating our apology to all of the patients who've waited longer than would have been deemed necessary should this error not have occurred. And I want to remind the committee that these patients were predominantly from the Dartford, Gravesham, Swanley, Bexley and Greenwich catchment area, and not, for the focus of this committee, from the majority of the Medway population. I also want to reassure the committee, as is contained in the report, that when the referrals were first received, each was reviewed by a senior clinician and allocated a clinical priority. And as such, we are fully assured that there were no urgent or cancer patients caught up in this cohort of patients. Since this came to light, we have taken action to ensure that all the referrals are correctly managed and new policies and processes have been put in place. And since July, we have doubled, with the support of the ICB, we have doubled our ENT capacity across the catchment population that ENT serves. And again, reminding you that the ENT service has and always did service the population from Bexley through to the other side of Medway. It wasn't a Medway-only service. At the time that the patients were identified, the average wait for a Medway patient was between 60 and 77 weeks for first outpatient appointment. In the report, I noted that it was back down to 77. We have improved on that since the report was written. We are now at 72 weeks. We are confident that in line with NHS England operating and planning framework that we will have eliminated all 65-week waits, not just in ENT, but across all of our waiting lists by the 21st of December, and are on track to deliver nobody waiting over 52 weeks by the 31st of March. An investigation is currently underway by NHS England as to round the root causes of this incident and why it went undiscovered for a significant period of time. I noted in your opening comments, Chair, that you that there isn't the detail that you would like in this report, and we will happy to prepare a briefing paper for you. Some of the reason for that is the ongoing investigation. I'll leave it at that.
Okay, members. Councillor Wiley.
Thank you. First, I think it would be more interesting to see the detailed report and the reasons which, you know, that will be good when that comes out. But can you tell me how, in the great scheme of things, 8,849 patients, is that a year's worth of what the ENT see, or 3 months, or can you put the numbers in some sort of perspective?
The 8,849, the longest wait was about 4.5 to 5 years.
No, I don't mean, how many people are seen by ENT during a normal year?
So the average number of referrals across the service is 400 a week. So 400 times 52 is somebody better at mental maths than me.
Right, but that still makes that number 3-4 months worth of people just disappearing, you know, off the screen. It's a very, or should be a very noticeable number. I can't understand how it built up. Now, if you're doing an in-depth report, I'm happy to wait for that, but it just seems amazing that that number of people can disappear through a system.
So it wasn't that there were 8,000 and then there were 8,000 lefts. It is over that time period that it built up to that number. The reason that was not noticed and wasn't picked up on annual reviews and performance reviews is part of the investigation that NHS England has commissioned.
Yeah, and to see that report will be interesting and, yeah, probably give us more questions than answers, but yep, I'm happy to leave it there and come back when that report's available.
Thank you, Councillor Wiley. When is the report going to conclude? Graham?
So I did ask, so we're, as you're aware, we're part of a tiering system of NHS performance management. I have asked that. The investigator has been appointed and is active at the moment. We're hoping for first draft by the end of this month, but that will obviously depend on her being able to get all of the people that she wants to talk to.
Thank you. Councillor Goldwyn?
Well, my experience, again, was with the ENT was very mixed. The initial appointment I had with the ENT, I got quite fast because I was referred by the urology department. It was when I had the pre-op check to having my prostate removed. They found I'd had quite a nasty throat infection. I just put it down to a tickly cough. I think I was seen within a week or 10 days, something like that. And I've got to say the examination wasn't too bad. I wouldn't say it was pleasant having an endoscope poked up one's nose and down into one's throat. It was not, and I was prescribed a course of antibiotics, which I think was 10 days or so worth. When I got to the end of that course of antibiotics, my throat was feeling no better. I went back to ENT and explained that the antibiotics hadn't worked. I was told it was not a drop-in service. If I wanted any more antibiotics, I had to go and see my GP, which I did, and he prescribed a much stronger dose, and that did work, and I had another referral back to ENT when they confirmed that the infection had gone. And that's not the only time, if I can just, if you indulge me for a moment, please, Chair, where things go wrong, it's very difficult for a patient to get back into the system. After I was discharged after the prostate, in the week after that I was discharged, I had to go back twice because things were wrong. The first time I waited just under 6 hours for somebody to see me, a urologist to see me. The second time, it was about 4.5 hours. The third time, I had a problem. I got my wife to phone up the Spire Hospital and asked if they had a urologist who I could go and see. I did. I saw him 2 days later, and he was one of the urology team that I'd been seeing at Medway Hospital. So I could go to the Spire Hospital and be seen within quickly, because I was not prepared to sit there for hours again. So there is something there that needs to be looked at. It's just not right. I mean, to tell somebody that you're not a drop-in service, I think is the wrong approach. She was very abrupt with me, and I was told no uncertain terms that I was wasting their time and I needed to go back and see my GP. But they were the ones that prescribed that course of antibiotics. It hadn't worked. Surely, they should have still had responsibility for me. And it's things like those sort of incidents that let the whole side down. I mean, the fact that I'd had my prostrate removed by a fantastic bit of kit, Hugo the robot, who I asked to be introduced to on my way in. And incidentally, when I went into that operating theatre, the consultant was Egyptian, the anaesthetist was Chinese, and the rest of the team were half a dozen Filipino ladies. Where would we be without those people coming to Medway, to Britain and Medway? And I actually had my photograph taken with the thing. So, this is what is makes me so angry about Medway Hospital. Certain things are very good. That investment in that piece of machinery was absolutely fantastic. And I was one of the first people to be have the privilege of being operated on by it. The investment was there. The people involved in that were absolutely first class. But then I was left, a day later, I was left in a ward for hours, a side ward, and nobody came to see me for about 6 hours. The only way I got out of that situation because my wife kept phoning, and the phone was the other side of the room and I couldn't get to it. And eventually somebody came after a considerable wait with me sat in a very uncomfortable chair for hours. And that's what the complaint was about. So, you've got so many good things going for you, but there's other times when things just fall down. And to me, that was very fun. Sorry about my rant.
That's okay.
Dan, I do feel very strongly about it.
It's not really a question for the team. You just tell them your experience. That's all right. Okay, Councillor Crozier.
Yeah, sorry. Thank you, Graham, for your report. You mentioned about the waiting list of being 8,000. Were you accounting for the people that weren't actually on the waiting list but had been referred by the GP? Because I think I was certainly referred, but I was never on the waiting list. I had to wait to get onto the waiting list for 16 months before and then I was on the waiting list. That's one thing. So is it 8,000 or is it 16,000 people? Because there was another list of people that weren't on the list. The other question is when I eventually got to ENT, it seems that everything is still on paper. There's still blocks of, everybody's got a block of papers in a folder. Is that not supposed to be online by now?
So if I deal with the 8,000 first.
The 8,000, yeah.
The overall waiting list for ENT, I haven't got the number with me, but if we're going to put in a detailed briefing paper, then I'll make sure that the total list, the 8,849 were those who over that 5-year period had been, so I'm trying not to use a pejorative term like lost or forgotten or anything like that. There was a process that is now being investigated to find out why those were missed. So over a 5-year period, a group of patients numbering 8,849 were not managed through the process as they should have been, or as well as they should have been.
Can I just be a bit more specific then? So I was referred by the GP,
Yeah.
but I couldn't get on the list for 16 months.
So at the point that we discovered, the waiting list for first appointment from GP referral to a first outpatient appointment in ENT for a routine referral, so something that isn't suspected cancer or considered clinically urgent, was at, as I said, between 60 and 77 weeks, so just over a year at that point. So from referral to first appointment would have been closer to 12, 13, 14 months in that first instance.
So how did you know that those people that had been referred but not on the list, why wasn't the list extended? I can't understand why.
So once we found the people that hadn't been processed through the list properly, they were added to the list, and we're now working through to clear that. And that's why we have doubled ENT capacity, as is in the paper and as I mentioned in my opening comments. And we have now got the waiting time back to where it was at that point.
And I got 2 referrals at the end of my list. I got 1 referral store, and then a week later got another referral for a fortnight.
Sorry, I turned off. Sorry, did you want
I don't
to
want to really
Chair?
get into the personal stuff now, but Councillor Crows is right, asking a question, but I don't want to get into the thing maybe about if you've been missed off, Councillor Crows. We need to work that one out.
In terms of what you witnessed in the outpatient department of it being a predominantly paper-based, that's true. Our electronic patient record system is not yet rolled out across the entire organisation and into every department.
Thank you, Councillor Crozier. Can I just check before we close up, Graham, the role the ICB are playing in this, but did you escalate this to NHS England? NHS England are doing their escalation process, aren't they, and doing it? You did that yourself, didn't you? You moved it up to that, didn't you, John?
Yes, I mean, the external review will include the ICB. The external review is being undertaken by NHS England. They're spending most of their time with our trust, some time with DGT, Dartford and Gresham Trust, and they'll spend some time with the ICB, and the report will cover all those aspects.
Thank you.
We assume the investigation will cover all those aspects.
Okay, so just closing both items, the committee remains deeply concerned about both the findings of the culture review and the handling of the ENT backlog. Thank you for both for your, all of you for your explanations. I know, John, you'll stand for the next time now. We expect to obviously see clear, measurable improvement, not just in words, but in culture. It's not the first time I think we've said it here, but hopefully in leadership, behaviour and patient safety outcomes for staff as well, you know, because we need that there. Obviously, I've said time and time again that staff deserve dignity and patients deserve competence as well. So it's a mix of both. We welcome your assurances given today. Believe it or not, I do welcome your assurances. However, scrutiny will not end here, and we will expect regular updates, transparency of data, and accountability at every level until, hopefully, the public confidence in Medway NHS Trust is restored. What I will say, though, to end there, is it is an amazing hospital. You've got amazing staff there and amazing services that all of us, our family members, may have been involved in at some point or another. This cloud is an unfortunate one that needs to be resolved. The cultural one especially needs to be done because it taints the amazing work your wonderful staff do. And I've got to say that because I'm not saying leadership don't as well, but don't hit me after sure. I'm not saying that, but it's really unfortunate for your staff. And John, I can't tell you both that more. It's really poor to allow your staff to have those busy days that Councillor Cook talked about, those stressful days in A&E and others, and having CQC and everything else over their shoulders, as well as having to suffer this cultural behaviour as well in your hospital.
We've let some of our staff down,
yes,
and we apologise for that.
Thanks, John. Thank you. Vice Chair.
Do you want me to note that concern part, or is that already minuted? Yeah. And are we requesting a briefing paper with more details? Okay. I move that the committee notes the report and asks for a briefing paper with the plan for addressing the issues with the culture. Thank you.
Is that seconded? Seconded. Is that agreed, members? Agreed. Thank you very much. Thank you very much for your time. Thank you. Thanks. Thank you both. Thanks, Graham. Thanks, Sean. Can I ask the Community Services Procurement Update individuals to come up, please? Hiya, Ed. Hiya. Would you like to introduce yourself, please, to the committee? I know we know Ed very well.
Yeah, of course. My name is Pauline Butterworth. I'm the Deputy Chief Executive and the Chief Operating Officer for Kent Community Health.
Welcome, Pauline. Welcome. Would you like to just give a quick overview, Ed, where we are at this late hour?
Yeah, sure. So we promised we would bring back the community services contract on a regular basis to keep the committee abreast of progress. The last time we came, we hadn't quite signed the contract. The timetable for all of what's passed is laid out in the paper. I won't go through it all. The biggest change since we were last here is that the contract is fully signed, including all the subcontracts. That includes the subcontract between KCHFT and MCH in Medway as the provider partner. The next phase is, as we discussed last time, the mobilisation of the contract, which is happening for the 27th of October, which is when the new contract kicks in. And we are in the midst of just finalising those arrangements, which Pauline and I are happy to talk about, making sure that transition to the new model happens safely. And we described last time the plan for the sort of transformation part of the contract to subsequently, after the safe transfer, begin in earnest. We've laid out in the paper how that will work. The timetable is that we'll have a plan by March, and we've laid out the engagement exercise, which we hope will include members of this committee. And that's all I was going to say in the interest of time.
Yeah, I think it is. Members? I know I'm going to have a load of questions. Councillor Wiley.
As you've probably noticed, we're not too enamoured with the ICB and history. I mean, going back over many different service changes, they haven't gone smoothly in the past. This is a major change. Happened very, very quickly. I remember the first meeting on this where we were not happy at all, and the chairman said, well, this should be a 2-year process. We would look at different things as they came forward, etc. And now, 9 months later, it feels something like that. You're signing contracts. Doesn't it always happen? Right. I don't know about anyone else, but I have not much confidence that going forward these are going to all run smoothly. And the ICB are going through your problems. So you're commissioning all these services. You're being cut or not being cut. Your finances are being spent in a different way than previously. And we're not even sure who's going to be in what role next week. That's the way it looks to us. I don't know how it feels to you, sorry. Does none of this looks like it will run smoothly? And the only date I could see for the contracts at 3.9, they're going to run for 5 years with a possibly 3 years more. I would have thought, as some of them are new, especially some of the providers haven't provided that particular service before, it should have been at most a 2-year with a potential break, well, even an annual break if they start to fail. But the only problem with that being is you'd struggle to find any other providers.
So there's quite a lot in that. So shall I start from the perspective of the ICB? So we are going through some changes at the ICB, which we've talked about here as well. Yeah. Whatever happens to the ICB, and I hope to be here next week as you describe it, but whatever happens at the ICB, this is a core part of the future of health services in Kent and Medway, this contract. So having a stable community service offer, partnering primary care that we want to strengthen as well, keeping people well in the community is a fundamental part of trying to manage an ageing population's increasing health need in the way that we need to. So whatever happens to the ICB, this is a fundamental part of our strategy. The providers to which the contract's been awarded, the head contractor and the subcontractors are experienced providers of this sort of service. They're not coming to it fresh. It is important where we envisage the sort of transformation that we need in a contract of this sort to give people a length of contract that allows for transformation to happen on a stable footing. That's the rationale for the 5-year term. It's also not in our interests as a system to be in a constant cycle of short-term procurements that throw everything up in the air, that get in the way of good planning, and that prevent us really thinking about what will improve the services for your residents. So that's the rationale for where we are. When it comes to what will change, the services have moved across as they stand because we absolutely see that the important thing in the short term is to make sure the transfer happens safely, there's stability, and then we have the discussion about transformation, for which our ambitions are high. They're bolstered by what's in the 10-year plan, which comes in behind the ambitions of this procurement. But I don't know if, Pauline, do you want to say something about KCHFT and your plans?
Certainly. I think the key thing within this contract for us is to, obviously, it's coming across as is, and then there's an expectation that we'll have significant transformation and that we'll work with the ICB on what that looks like. We'll also work with communities, because fundamentally what we have to achieve is something that I think's been spoken about a bit tonight, is we have to be able to achieve that neighbourhoods and communities get what it is that they need, and that the health inequalities that sit within those neighbourhoods are addressed. And so I think that that transformation, that ambition for us is very important and central to what we want to do. And again, it's part of the 10-year plan, isn't it, to get things into the community rather than people turning up to acute hospitals and hoping to get services. We know that that isn't working, and we need to change the model fundamentally, and that's the intention of the transformation for this contract.
I just struggle with the word stability because, well, lack of confidence, especially with the time scale in which these things have been done. They're normally done over a much longer time with much more consultation, and they seem to have just been pushed forward.
Well, the procurement started some time ago. It procured an as-is model with transformation. It has been done relatively decisively. I would call it decisive rather than the way you phrased it, Councillor. It's in the interests of all of us, I think, that we move to do something differently quickly, not spend a lot of time on process. So we've tried to move quickly. Quite often, the criticism is the opposite, that some of these procurements take far too long to make any change. And what we're trying to do is get to a point where we can crystallise the change and we can start to make it happen.
Sorry, I just want to say, Ed, though, you do know this scrutiny committee as a problem with as is, right? Because we know it's not as is because it's totally changed. So you've got all these contracts in one now, so it's totally changed. But the as is part, I think what this, and I've come to one more member, Councillor Wilder, don't worry, I'm going to ask the question as well. I think it's only fair that the 2-year journey, which Pauline, you'll be glad you wasn't part of, and I'm sure John will too, we've had a real struggle for 2 years with this contract. You know we have. Ed, you wasn't around at the first part of it, but we have had a terrible journey on this. And we wanted clarity. We wanted to make sure that it's going to be clear and work properly. And then all of a sudden it's happened. I think that's what Councillor Wiley is saying. We're not criticising it. We're just saying that we've gone through a process of, and Pauline, you may want to know, so a process of non-engagement. First of all, there was no engagement. And we pulled up on the very first time the people come in here. There was no engagement whatsoever. And we were told to take it as is. And we didn't. And I'm glad we didn't, because that's why we're hopefully in a better place. But, you know, Councillor Wiley's asking a question, and it's a fair one, about the nervousness of the project. John, you can come in, but go on.
Sorry, as well as chairing Medway Foundation Trust, I'm also chairing Kent Community Health, NHS Foundation Trust. I think the one thing that has changed that can give you comfort is we've had the 10-year plan published. And the 10-year plan is very clear in terms of some of the key essence that is expected in terms of community health. So neighbourhood health and how community services can work in terms of helping with the neighbourhood health alongside our other partners is something that wasn't there 2 years ago. It's there now. So actually it's not a blank sheet of paper to make the changes from as is. Now you might say the timing's just been fortuitous in that, but I think that really does give us a really good building block, so that there shouldn't actually now be surprises in terms of the things that will come forward in terms of wanting to transform our services in line with the neighbourhood health models that will be emerging. So I think that can give you some comfort in terms of where we go from here.
I'm going to come to Councillor Cook, but the thing I'm going to leave you with, and I'll touch on it when it comes back to me, is don't forget the as-is is going to change because of transformation. And as a large organisation together, you'll probably be coming here a lot more with SVs, substantial changes, and you'll be relying on us and Kent to nod those through, or to tell you, you'll be telling us they're not substantial variations, we'll be probably telling you there might be. So the relationship has to be there to manoeuvre it along, because of course, and I agree, some of these contracts do need to be changed. But you're going to still need that consultation, especially with our residents, to move it forward. Councillor Cooks, I've missed you. Sorry, Councillor Wiley.
No, thank you. I think just really along those same lines. So I feel a little bit like I'm the KPI woman in this discussion, and I've been really grateful for you, you know, journeying with us and us journeying with you. And fundamentally, the question I'm asking myself all the time is, am I confident that the questions I'm asking will mean that what our residents in Medway receive in the long term is better and better and better? And I know that's exactly what you're doing as well. And what I read here, I got to kind of key milestones. It's like, right, we're going to start to see what it looks like. And I know you've really worked with us to help us to understand that it's, you know, that conversation about as is, and I really take what you said there, Chair, but, you know, nothing's changing in year one unless it's things for the better. But then these transformation plans are going to come in for year two. And then the milestones, all it really told me is, and they're going to give me a transformation plan on this, and they're going to give me a transformation plan on that, and they're going to give me a transformation plan on that. So I don't really feel that I'm significantly further on through this report than I was the last time we looked at this, because I knew that contracts were going to be awarded that were going to give us transformation plans in these areas. All I know now is that you've now given that contract to people. I don't personally, unless I'm missing something, feel reassured that those contracts have been given in a way that I can confidently say right now, and yes, that's going to lead to better outcomes, which is what I think I'm, you know, predominantly meant to be asking and what I've been asking. So I just found it slightly frustrating as someone who is looking at it perhaps from another area, not an NHS background, around this doesn't actually tell me a huge amount more than the last report did, if that's fair, Chair. Thank you.
Ed?
Well, I mean, all I would say is, in one sense, you're right, because we've come again to the next meeting. The timetable itself hasn't changed. There was never likely to be a significant shift between the last update and this update because of the timetable that was set from the beginning of the procurement. So I understand your frustration and your impatience. I have the same thing. You know, I'm a few months into the ICB. I want to get on with Pauline and colleagues to make some of this real quickly. And, you know, we'll keep coming here to tell you how that is happening. My focus in the short term with Pauline and colleagues is in the next couple of weeks to make sure that the contract mobilises in its new form in the right way, and then we're straight onto the best bit.
I mean, for me, look, just for me here, I think the problem is it isn't about here and now, because you'd hope that the people you've given a contract to, they're going to mobilise it and move it, and, you know, and I'm going to ask a couple of questions on it at the moment. I think the problem we all have is about what that transformation, beautiful, wonderful bubble of the ICB is. And it's always been that, Ed, hasn't it? I mean, I'm saying always, sorry, you've only just been in front of us a little while. But you have your ambitions, that's why you attach that document into the plan. We still can't see that, and we can't see that wonderful transformation as yet. And we've kept asking, because you've kept saying you've had this transformation, you all wrote it, it was wonderful, the transformation has always been the vision. We're not confident it's there yet, and we're probably going to be moved along as you go along with the contracts, because we still haven't seen that proper vision. But let me just ask some key questions. You're going live on the 27th of October. How confident are we that all the TUPE transfers and everything's going to go through? Is that all moving wonderfully? And on the 27th of October, you're going to be there, Pauline?
Our expectation is that we will be, yes. We're doing a lot of work around the TUPE transfers at the moment, and Mairead and the other chief executives are in conversation with each other around that. So I'm not saying that there aren't hurdles that we aren't trying to get over at the moment, but yeah, I think we are confident about that.
Because there is another gap that the members are not really clear, and maybe don't even know some members around here, and it's key because they should do, because MCH will change quite significantly because of going into this. It's all, a lot of the services are changing and you're becoming more together, and which isn't a bad thing, but all we ever spoke about on this table is our MCH and about the services they deliver. So, you know, again, can I just talk about the consortium? And John, this might be for you rather than pushing it at Pauline. So the consortium obviously includes, KCHFT, I hate all these things, and MCH, but also HCRG, right? So they've got a bit of a checkered national record with services. What assurances did you have that their service quality and workforce conditions, that would be good as a part? Is it all coming together nicely? Because, you know, nothing would be compromised by outsourcing to the public sector or anything like that?
So I think one of the things about all of us working together is that we had that discussion earlier about standardising to the best. So that's what we will do. And clearly as lead provider, we need to ensure that MCH and HCRG are able to do that. I think there are some, there are some local examples where HCRG has worked well with DGT, Dartford and Gresham Trust. Their no criteria to reside is at 60 patients at the moment. At MFT, our no criteria to reside is about 130 to 140 patients. That's partly to do with the work that they're doing. So I think there are some concrete examples, and that was shown in the bid, in terms of good work that they have done in North Kent.
North Kent, but, you know, I was talking about for, you know, their record as a whole. There's no compromise with regards to there is a plan in place. If one partner fell, then there's a plan in place that KCH will be able to take it all on.
Well, I mean, the contractual structure is very clear. We're contracting with KCHFT as an ICB. KCHFT are the provider. They have subcontracted some components of the contract, and we will hold KCHFT to account for delivering against the contract in the usual way.
So the clawback.
So it's on our head. It's on Kent Communities'
So the clawback
head.
and the performance penalties will be all on KCHF. Will be on them and nothing else. And finally, you say about I'm going to talk about this transformation plan. I don't know why I keep talking about it, and I have a smile on my face when I talk about this. It's coming in March 2026, right? Is that what we're saying? 17 months into the contract. how will we
No,
have...
6 months in.
Yeah, but how will we have, 6 months from now, but I'm talking about from the beginning of the whole process when we start talking about it. How will you ensure that this committee has the regular, meaningful oversight of that? And not just noting updates. And I've said to Moray the same, because we're not just, we will be expecting a proper update on some of the stuff. And you'll probably be definitely wanting to come to us anyway. But we're going to be wanting reassurance on engagement, performance, community outcomes, especially engagement with our community. How is that working within the contract, Pauline?
So my expectation is that we will be looking at how we work both at neighbourhood levels and super neighbourhood levels in relation to how we want to plan the transformation. I'm personally very excited about it. I think there's loads for us to go at in relation to some of the things that we can do together with MCH in the Medway space. We're already bringing together children's services and trying to look at what the SEND agenda should look like, working with KMPT around transformation to make sure that mental health for children is part of a joined-up service. And again, looking at the frailty pathways, the end-of-life pathways, all of that forms part of our transformation. As you say, we're not going to do that transformation without talking to the communities. We're not going to do that transformation without talking to yourselves. Some of those things we have to bring to you, some of those things we'll want to bring to you. Because fundamentally, we need to understand what you want and need. And your communities are the people to tell us that. So I think what we've got to do is be quite bold about our engagement with these things and be really clear about the things that we're actually trying to achieve. I know that you've alluded to the ambitions, and the ambitions are quite big things. But the devil is in the detail of how we deliver those ambitions, and they're delivered at neighbourhood. And some things won't be delivered at neighbourhood, but let's hope that we can get most of it there.
Can I just put it out there, Pauline? Sorry, John. Can I just put it out there? We're not, we're excited by you taking on and doing the project. Our confusion has always been, as Ed will know, is around this transformation I've always spoken about. Can I just also to finish? The co-production and engagement panels, you're starting in October. When are they going to be live? When are you going to be doing this co-production and engagement panels across the board?
I don't have exact dates for that at the moment, but we will have them soon. So as soon as we know, we will let you know.
So 6 months in, a year in?
Oh no,
because you would have given the timelines to the ICB on that
yeah.
in your application.
Yeah.
So that's a really important part. Councillor Murray mentioned it right at the very beginning about that co-production and that engagement. Are we not talking long into the contract before they go live?
No, we won't be talking long into the contract because we have to be able to do the transformation. So we have to set things up as quickly as we can.
Okay, John, do you want to finish?
Just so very quickly, the co-production, of course, includes social care. So in order to do the transformation in terms of neighbourhood health, super neighbourhood health, we need to work with Jackie, Leanne and their teams. They'll be part of this.
And we'll be asking, holding them to account on that as well. So, thank you, John. I've got nothing else from members. Vice Chair.
I move that the committee notes the report.
Thank you very much. And we look forward to, we always look forward to seeing Ed anyway, but we look forward sometimes. But we definitely look forward to hearing more about it. And maybe you and Murray come along and talk to us properly about what you're going to be doing and what your vision is properly. Or maybe have an offline. We did say we'd have an offline development we have offline development sessions. We do it online, but it'd be really good maybe to give us a bit of an update via one of those sessions rather than coming here just to see how you're getting on. Thanks. Thank you, everyone. Thank you for your time. Is that agreed, member? Sorry, it's got late now. All agreed? Agreed. Thank you. Thank you. Can we have the pharmacy team? If anyone wants a quick 2-minute comfort break, please take one. We'll move it on, but you can take one if we want to.
Dan, I'm about to leave. Thank you very much for having me
Murray.
this evening, and I've really enjoyed being here. Tomorrow, I'm having my flu jab in public to encourage everyone else to have it. And may I say to people around the table, if you're eligible for a free jab, please have one. And even if you're not, think about paying for a jab. We really want to take the pressure off the hospital this winter as much as possible by getting people immunised. You're not just protecting yourself, you're protecting everybody else as well. Thank you.
Definitely. Thanks, Councillor Murray. Make sure you have a first aider there with you, just in case. Okay, we're moving on now to the pharmacy item. Would you like to give, Suk, would you like to give any highlight at the beginning?
Yeah, no, thank you. Just to introduce myself, I'm Suk Singh, I'm the Director of Primary and Community Care. So I'll take the paper as read, but the thing I just wanted to really point out is that in terms of managing the contractual requirements for community pharmacy, there are regulations that are set nationally in terms of how we do that, and there are some processes that we have to follow as we work through some of that, which obviously is applicable to what we're dealing with in the situation in Rainham. So that does include the process we have to follow around local dispute resolution, the work that we need to do issuing contract breach notices, but we also need to allow the contractor time to respond to those breaches and try to rectify those issues as well. If we get to the position where we want to potentially look at removing the pharmacy from the pharmaceutical list, the pharmaceutical provider themselves have the right to appeal against that decision, and they can also take the process through NHS resolution as well. So I just really want to set the context actually that we are following the process that is set nationally in terms of how we deal with any other contractors that aren't necessarily delivering what they need to do in terms of their contracts.
But unlike the P&A, you are there for quality. It's the quality where we're looking at resource provision. Your part is the quality area as well, so that's the quality of that provider. Councillor Nang, I'm going to bring you in because I closed you down on the very first question to Councillor Morris, so now you'd like to ask your pharmacy questions to Suk.
Okay. Thank you very much for the brief. Well, like as I was saying, most of the residents of Rainham want to know that if youth pharmacy owed a service contract, like the chairman said, you were supposed to be checking them on when it comes to quality of service provision. So they feel you might have let them down because it's gotten to this level that they are not receiving the services that they are supposed to receive because they feel there was no check and balances. So that's why they've gotten to this point, and they are going to lose that service provision because when the pharmaceutical need assessment was done, though they were operating in quotes, but they weren't getting any services from them. And then the second bit is they feel that there's a national challenge that is going on with that particular pharmaceutical service provider. So they want to know how sure or how do you think that service provider will be reliable in providing them with their services?
Do you want to come back on those couple of questions first?
Yeah, sure. So as I said, there's quite clearly set out nationally the processes that we have to follow. So, for example, when there are concerns raised, we will go through and we'll obviously engage with the provider. We'll look to see what we can do to remedy that situation, and then it might go into the process where we do need to issue contractual breach notices, which is the process that we would follow. In terms of the actual provider and the national issues that there are, in terms of where we are hosting in terms of South East region, we're the only region actually that have actually removed them from a pharmaceutical list because they haven't necessarily delivered what we need to do in terms of the contracts. So there are obviously broader issues that need to be picked up, I guess, in terms of some of the national conversation I realise that are going on with that provider. But from an ICB's perspective, we are following the regulations as are set out and defined nationally in terms of what we do in terms of contract management and delivery of those services.
Councillor Nang, did you? Ed?
Just the thing that I would make sure that everyone is clear about, because it's not obvious, is pharmacy is a very different setup to all the other services we commission almost, because effectively what there is a highly regulated and prescribed set of market entry regulations, which we administer. And Suk's described the way in which we can enforce against contractors that aren't doing what they're supposed to. But every site is treated as a separate site when it comes to the way the pharmaceutical regulations and rules work. So we have to follow the process in relation to individual sites, and any accusations that the service at individual sites is not what it should be. Just to explain the process we have to follow.
Councillor Nang, are you content, or are you anything else, or are you content with what you asked so far?
Yes, I think the major issue with the residents of Rainham is it took so long for ICB to start the process of making sure that that service provider, though it was not giving them the right services, nothing was done about it till it was too late, because that's what most of the residents, because they were not receiving good services from that particular service provider, and it took so long, and still nothing is being done to them, and they are losing that provision. And with the population being an aging population, without them having that service provider, because just imagine someone moving from Lower Raynham to travel all the way to maybe Tesco or to Parkwood for pharmaceutical services. Therefore, they feel they have been let down by the ICB because there was no check and balances on the service provider, which was not providing the right service, and nothing was done about it.
So what we've got, and I think it's in the paper, we have a Pharmaceutical Services Regulation Committee. So they will review, I guess, when we have concerns that are raised. As part of that panel, there are lay members there as part of the panel, so it isn't just an ICB on our own kind of sitting in that conversation. But we will consider all the evidence that's been presented. And I think in this situation, we have acted as quickly as we can do in terms of following the processes as they're defined nationally. I think, as Ed kind of alluded to, I think the bigger challenge we've got is that it's quite well prescribed in terms of what we have to do and the processes that we have to follow. So as an ICB, we've acted as quickly as we can do on the concerns that have been raised.
So for me, I mean, I'm going to say it. I mean, you know, it's easy for me to pick up from members because you're a member. So we've been talking about this a long time. We've been talking about it quite a while. I think we also had a members item come back from the Raynham North councillors here. And at that stage, everything was absolutely fine. And we knew it wasn't fine, even when we had that members item, which was in March time, I think, or March, or could be, it was March. And I remember that members item, and I remember saying to you there's significant issues. There was issues then with that pharmacy. There was issues then where they were closing like certain days, they weren't open, you go up to them, the door would be shut, there'd be a notice on there. At one time there was a bailiff notice on there, so on and so on. And I'm happy to say, I can say it, Jutes, I'm talking about Jutes here, the pharmacy. And we were here, and, you know, I'm not, you know, we had serious concerns about that in March. And here we are now. I think they went to that process on the 9th of October. Now, when I mentioned there was significant issues with that pharmacy, I remember you saying to me there was no issues there. I remember you saying to me that, again, it's the same thing that comes out. And I'm not, you know, I know you have to say it's this. The regulation at this moment in time is a sham. Everything from the P&A right the way down needs total change nationally because it's just ridiculous. Because I remember you saying to me then, well, there's a pharmacy at Tesco's in Gillingham, the big one. There's also one in Parkwood. You know, we've got a lot of older people that live around that area in Raynham North and Central that are not going to walk off to Parkwood to get their tablets, right? If you go down to the smaller, I'm going to call it small, even though it's in Tesco's, you go down to that pharmacy with your prescription, 9 times out of 10, you're probably going to have to come back with your slip of paper because they won't have all of the medication. And we lost two pharmacies anyway. We lost Boots and we lost Lloyd's. And I remember then, which you was doing really well, so you defended it because you're saying this is the process, this is what's there, and they are there. And I remember saying to you also then, very clearly, that people had even applied to open a pharmacy there, and they were. And I remember you saying to me they didn't, but they had. And again, people have applied even just recently to you to open a pharmacy, not you know whoever it is, but to you guys to open a pharmacy. And you know, in their decision note, it says no because Jutes is there. We got Jutes, we got them. You don't just say Jutes, you say it's well served. Knowing full well it hasn't been well served for a long time. From 27th August, the doors have not been open there. But before then, they were closing. They didn't have locums on weekends, didn't have proper provision. And the ICB didn't do anything about it. The ICB may have stepped in now because we've got surveys. You know, if you ask, you've got the local MP doing a survey there, doing the ICB's work for you. And how terrible is that? I mean, good on the local MP, good on Nashaba Khan there for doing it, but she's going out to the people of Rainham and doing a survey, and just in about, what, 3 or 4 days, she's got 230, 40 people already come back. And it's clear, all of them, 81% are dissatisfied. There's no pharmacy open there. They want their local pharmacy. But we have to keep saying that to you. The residents have to keep saying that to you. You get all emails and letters, I'm sure. The MPs have to bring it up. The P&A, and I'm going to bring David in this because you heard me. I mean, I did give the P&A, we gave the P&A item in August a hard time because actually you had the guy here, Mark, from the pharmaceutical, wherever it was, and I said, did you not know that there's problems going on in this pharmacy? And there was a smile. And yet here we are, because the only people that lose out here are the local residents. I'm not going to say to you forget about procedure, because you can't. Procedure's there, you have to follow it. But really, March to October, when everyone else knew there was major problems with that pharmacy, and you take it in October. I mean, what was the delay? Why was there a delay for not doing anything about an incompetent pharmacy? And you know, I can go into incompetence right away from not being open, right away for not paying their staff or doing anything. I'm not asking you to comment on that. I can. I'm not asking you to comment on a pharmacy not paying their staff and not getting locums. How come it takes so long before the ICB to step in and do something about that? Can you just tell me that first of all? Why? What was it? So all of a sudden you was told at the end of August, let's take them in October, or what?
So it hasn't just been since October that there's been actions taken. So we've been working with the pharmacy. As I said, we have to go through the process of dispute resolution. We have to look at working through an action plan with them, seeing what we can do to remedy the situation before we get to the point of actually then being looking at how we can issue a contractual breach. The Pharmaceutical Service Regulation Committee will review that information and make a decision on what's the most appropriate course of action. So it's not just a case of we've only just started doing something now. We've been working through what we need to do over the last so many months as well.
Okay, but you have a service that's not operating, and you have to go through a process on that, probably months, whatever that is. I know. But then when people are applying to open a pharmacy, to open a pharmacy, they're being told no because you can't. You have no other choice because that pharmacy, even though it's not operating properly, is still on the list, and it has to be on the list officially anyway. Is that what we're saying here?
I mean, yes, until a pharmacy is removed from the list, it is on the list. I mean, it is not, just to be clear, it's not in our interests for the population to be poorly served by the pharmacy service. It's an incredibly important thing that people get their medicines, all sorts of things result if they don't, and therefore from our perspective anything that gave us more control over the commissioning of pharmacy would be welcome. As things stand, we follow the processes we've got.
But you wouldn't
I understand
welcome
some of the frustrations.
But you wouldn't welcome whoever it is from anywhere. You wouldn't welcome a new pharmacy provider coming in and saying we can offer a much better service there, even though you know the one you've got in the centre, right in the centre of Rainham there, is not operating and not operating effectively. And you know the staffing is not your issue, but actually treating some of their staff appallingly. You wouldn't entertain. I don't see what that big brick wall is when you won't entertain someone else that can come and do a better job.
So I won't comment on the specifics, as you've said. The issue we have is that we don't operate a commission service for pharmacy. We operate a set of market entry rules about who can be there based on, to defend to David and the team, the P&A, which also has to follow a set procedure to be produced in a particular way. In a world where, there are other examples of services where if we had a poorly performing service, and I'm not making any judgment about any particular pharmacy when I say that, but on other things, if we had a poorly performing service, we would take contractual action and re-procure to replace it. But that's not how the pharmacy system works.
So thanks for that, Ed. And we knew, and I will come to David, we're both doing it, but David, for you, we knew, obviously, I knew that, not just saying you're going to pass it over, but I knew the P&A would get the blame as well, because, you know, I'm just saying, because of the good regulation procedure. So, David, if I was to say to you, when are you going to go to the Health and Wellbeing Board and publish a supplementary statement of disclosure? Because even up to now, the P&A or you would say that Jutes is there and it's on the list and it's working wonderfully, and we all know it's not. So what happens, David? Tell me. We're all off. Me on.
Okay. So if the pharmaceutical list changes, and if the change in the pharmacies on the list then results in a change in the provision of services, then we can publish a supplementary statement to that effect. So we have to wait for a change in the pharmaceutical list.
So not that the surgery is not opening or serving its local residents or its cohort there, only when it's shut.
We can, also, if there are changes to the operating hours, we can publish a supplementary statement then.
So, Sook, did you say when we were doing the P&A, did you say to the team, not you, whoever it is in your team, did you say to the team, we've got issues with this pharmacy, it's not opening its doors?
Not that I'm well, I don't know if any of the team had raised it, but I'm not sure if that's the kind of thing that we'd pick up through the P&A in terms of what pharmacy is not opening its doors, but we haven't necessarily, depends on when the P&A was done and what the situation was at the time.
No, but surely you know when the P&A starts and when it operates. Your team, whether it's you or your team, you'd know. You're here on behalf. You and Ed. Sorry, Ed. 1 second, because I'm unravelling it here because we had a members item here in March where we was telling you that the doors weren't open and they weren't opening sufficiently. They weren't opening weekends. They weren't providing for their residents. There was a concern, not just from us, but I know you've had it from others, from residents and from, like I said, the MP, etc. It's been known for over 6 months that this pharmacy has not been serving its local residents. And that's where I'm trying to, it's not about the blame bit, although there's someone to blame, whether it's national regulation, whatever. But between the communication, we've got the P&A that comes out and is developed from March onwards, I think, or April, whenever. That come to us in August, and we mentioned again about this pharmacy being on the P&A and Rainham still being well served, when we all knew it wasn't. We were all laughing at that. So when does that connection happen, David, between you and the ICB about what's going on, or if there's any warnings, or if there's any problem?
So in the development of the P&A, we have to follow the regulations, and we can't take that into account. So if the pharmacy was on the pharmaceutical list and it had a set of contracted hours, so we have to consider that pharmacy in the development of the P&A, pharmaceutical needs assessment. Until that situation changes, we can't change the P&A.
And that still happens when you have a new application for a new pharmacy, because you've still got low numbers there, because like I say, I'm not asking you to take anything away, but in Gillingham we've got 16, we're lucky, right? But you talk about 4 in a massive area in Rainham, but even then you won't accept anything, and you would still use Jutes as saying we're well served because Jutes are there, even though we know they're not opening their door. I mean, that is I want members to understand that if you was to ask, and you look at the detail now, including the ICB and others, and the P&A, not your fault, David, because it's national, it will still come up your P&A and tell you that there's Jutes there and it's operating. Why do we need more? And when we know they've closed their doors on the 27th of August permanently, but long before that, they were never open, weekends, days, they're going in the afternoon, whatever. That is the carry-on you have when it comes to this regulation, that as far as it's like a ghost, they can sit there as a ghost and carry on, but not be taken down the road of, you wouldn't do that to any of your contract holders, would you, if you had full control, because you wouldn't.
I think, so, I mean, the other thing I would say is that if we had different, if the ICB had different powers in relation to pharmacy commissioning, there are also opportunities around what services you could provide out of community pharmacy to the population. As it stands, that's governed, we can only have discussions with pharmacy about their performance in relation to things that are in the pharmacy framework. We can buy things from pharmacies beyond the national framework, but what we can't do, as it stands, is commission for a particular kind of pharmacy service easily in the sort of free-form way that we do in other worlds. So
I'm talking about a prescribing pharmacy for residents
I know
locally.
I know you are, but there's
for
so
having to
much,
go down the road,
But a lot of what makes these days, a lot of pharmacies rely quite heavily on the income they get from clinical services as well as prescribing, and that is in part what supports their sustainability. So Councillor Murray was talking about flu vaccination, flu and COVID vaccination over the last few years, quite a substantial part of some pharmacies' income, quite important to them, their survival and their place in the community. So that there are opportunities, if the world were to change, for us to think more widely about neighbourhood health, what the role of the pharmacy is on the high street, and how you make more of it.
But you are turning down people that apply to come or may want to apply because they know they'll get told no, and we're turning down people, they're appealing it, and they'll be appealing it on a surgery that you say is wonderful and well served in Rainham, and it's not. I mean, I'm not going into the contract area. Councillor Wildy...
We don't make statements about pharmacies being wonderful and not in the process of the contractual management.
Your decision notice is very clear. Your decision notice comes back about what's already in the area, serving the residents, and well served, i.e. the area is well served for the residents.
But
it mentions Jews.
But those decisions are in relation to the existence or not of a pharmacy. They are not a comment on any ongoing process in relation to its performance.
That's what I'm trying to say, Ed. No, that's what I'm trying to say, Ed. It's not about whether anyone's any good. Unfortunately, because of the system and the way it is from a national system, on your paper, Jukes is still there, even if it's not. I mean, it's just bizarre. Councillor Wild.
Thank you. I'm going to repeat some of what you've said, sorry, but earlier on, Councillor Murray, I've forgotten the context, but she said experience takes a long time to get. And at the last item, I nearly went through history of all the times I think the ICB have failed the people of Medway. Now, Councillor Anang and the Rainham councillors brought this to committee and mentioned it even before and pushed it as a subject. And as Councillor MacDonald says, it didn't go anywhere. It was denied by what I've heard. Can you understand why we struggled to have faith in the ICB going forward when you're commissioning multi-services without proper consultation and without taking proper time? And coming back to this instance, you've got, 5 chemists in the same area. One's not working. Well, if you've got 5 registered, why can't there be a 6th which will pick up for the one that isn't doing its correct job? I cannot understand how you didn't or couldn't get involved earlier.
Well, I think we've explained how the pharmaceutical regulations and system work. The council's role is in production of the P&A, which guides our commissioning decisions about gaps in provision. As I've said, the teams work really well together. That's not a critique of the council's role. That is a process that's well prescribed. And we do the same on our half of it. So I'm afraid I don't accept that there's a failure in applying the national regulations. No.
I don't think that.
Sorry.
Go on.
So you're going to end up with multi-contracts, and I know this is going back to the last item slightly, and you're going to say, well, by the letter of the contract, if they're not failing in this way, but you're failing in that way, there's some things you'll listen to and some things you won't. And I will bring up the history if you want. I mean, the mental health beds, you took them out of and closed them in MFT, and then 2-3 years later...
Let's stick to the pharmacy,
well,
Councillor Wiley.
yes, but there are many contracts, in my view, that you have not managed well, and it seems this one is equally not managed well. And I know you've got all your reasons that why it couldn't be, but that's how I feel.
Okay. Councillor Godwin, because we're coming into the late hour now. Councillor Godwin.
Yes, having just come into this, I do find it exceptionally frustrating because, I mean, you've obviously tried to do something about it as a committee and nothing's happened. I think it's a classic example of bureaucratic buck shifting. And it's on the back of, as you said, Dan, local pharmacies are becoming a key part of the local healthcare system. In the last few days, I've had my COVID jab and flu jab at a local pharmacy. And certainly, having had to sit quite a while often to get my prescriptions, I have noticed that the staff in the pharmacy are dealing with a constant stream of inquiries. How, my child's got this, that, or the other. I've got a rash. What do you recommend? That is because for a lot of people in Medway, it is almost impossible to get a GP appointment quickly. So the next port of call for a lot of our residents is their local pharmacy. And if their local pharmacy isn't open, there is something badly missing. And if you can't grab hold of this, I think perhaps we need as a council to use our local members and a letter to say the system is wrong, that nobody seems to want to take responsibility for it, and we need to get change. I don't know how if the Vice Chair could word something along that we could recommend up, that we do take this further, because it's obvious we're not getting anywhere this evening. Nobody wants to take responsibility for a situation that somebody should be taking responsibility for. That's plainly obvious that the buck has got to stop somewhere. If it doesn't stop with you guys, what are you doing, So we need, and if you haven't got those powers, perhaps you should be given them as an organisation that's supposed to be providing comprehensive health care for the people of Medway. I share your frustration, Dan. This is ridiculous.
Thank you. Councillor Barrett, we'll close up.
Thank you, Chair. I may be repeating some things that Councillor Anag has already mentioned, but I was out of the room at that time. But just a bit of my history. I moved to Raynham in the early 70s with 2 young children. And at that stage, there was 2 chemists, one in Station Road, one in the High Street. And of course, they're now called pharmacists, but they were chemists back in the 70s. And they had this sort of red bottles and green bottles. I don't know if you remember. You probably don't remember that, but in the window. But anyhow, I mean, say things have changed a lot since then. I mean, say particularly in Raynham. I mean, say the population in Raynham. When I was there, it must have, well, if I said quadrupled, it would be an underestimation. But it's got immensely larger than when I was originally, there. And you had 2 chemists then. I would say up to recently we had 3 chemists, in the precinct there, and one was just outside, on the A2, and they must have been serving the public. So these people now are having to sort of go right into Parkwood or the like, and a lot of these people are elderly people. Not people like myself, there's a lot of elderly people. And they, haven't got cars, they might have to go on a mobility scooter, but it's absolutely ludicrous that they've got to travel that distance. And, well, it's common sense, that there's the need for, a pharmacy in the Raynham area. Thank you.
I mean, it's a good point you brought up, Councillor Govin, because, that frustration is clear between all of us, isn't it, with this national regulation. So if this committee was writing a letter to government to complain about the regulation, would the ICB support it? Would you support us in writing a letter?
I would want to read the letter to make sure that the detail of it was framed in a way that we could support, and that the way I would frame it from our perspective is that I absolutely agree with the centrality of community pharmacy on the high street, and I had my flu jab last week in a pharmacy. I was responsible for the rollout of the COVID vaccine at the point at which we started rolling it out to pharmacies in NHS England. I think there's a huge opportunity for community pharmacies to play a bigger role, and I think the way I would frame the change is an opportunity to do more in communities as part of neighbourhood health and other things, and we would support that, yeah.
So Ed, you know me, Sook knows me long enough. I wouldn't write a letter and put your name down and not send it to you. We wouldn't do that as a committee. What I'm trying to say is about we need to, and David would help as well, we need to frame the part about the regulation, especially the P&A, where we have the pharmacy on there that shouldn't be on there. And just some of those fundamental changes in procedures. And the reason I'm asking that is because I know that, and I'm going to say it again, thankfully we've got our local MP in Gillingham Raynham that's doing all this survey stuff. We keep it here very, and I'm going to say it, David might laugh, we keep it very, I always cross-party, always do. And the good thing about a scrutiny panel for the ICB, rather than joining up with maybe the cabinet member and the local MP, the scrutiny panel's a mixed political bag here, right? And we are here for the residents. So the reason I'm saying is if we all worked on a letter and worked, not all together put our bit in, it'd be worthwhile sending it, because there's going to be letters going off to West Street and others. But if we can do one joined up and talk about our frustration, surely that helps as well, right? I mean it's a key thing. But just my last thing for you, Sook, how long is this process now going to take with this current? I mean, I'm going to say it clearly. Jutes, it's chaotic across the country. It's not just in Raynham that they're causing concern. There's MPs fighting it all over the place with regards to their failure in their service. But how long before the residents of Raynham can maybe expect another application or someone coming in when this one goes?
So it depends on what they take in terms of an appeals process against any stage that we go through. So if they go to NHS resolution, that can take up to 15 weeks before there's an outcome from that. So it's, again, there's a process that they are entitled to be able to appeal decisions as well, and they can have that kind of independent review of their appeal as well through NHS resolution.
If they pulled out, if they just decided, yes, that's it, we close the doors, then things change, right?
That would, again, we'd notify the Health and Wellbeing Board, and then the Health and Wellbeing Board will make a decision about whether they want to issue a supplementary statement.
It's a sad state of affairs, and it's a really sad state of affairs for the residents of Raynham. I think, I know Councillor Murray talked about Peninsula earlier and stuff, of course, and we are trying to get a healthy living centre for Strood and other things. We want better provision everywhere. But it's a sad state of affairs that they've been let down by this organisation, and they can just sit back pretty, and you're the ones taking the fire from us when they're the ones that are providing a diabolical service to their residents or not providing a service to their residents and taking money for it in the same breath. I think it's disgraceful, and Jutes should be called out for that. They deserve better, the residents. Vice Chair.
Should I include that this committee will write a letter to the Department of Health? Okay, all right. I move that the committee notes the report and work closely with the council and the ICB teams to escalate the matter to government.
Is that agreed, members? Agreed, thank you. Thanks very much for your time for this later. Thank you. You're more than welcome to stay to the end if you want to. Let's go straight to item 9 before I get in trouble. Let's get straight there quickly, members. I know it's getting late. We will get done. We take the report as read, but please give us a bit of a highlight.
All right, so I'll just start off with the compliments. So we've received 32 compliments for the adult services, which equates to roughly 1 compliment every 3.5 complaints. And we know Jackie and her team celebrate the compliments and take them as valuable learning experience. In terms of performance, more than 80% statutory and all non-stat of complaints were issued within 20 working days. And whenever we do need more time, we do make sure that we are explaining the reasons for this and providing them with a revised deadline. And in terms of the Ombudsman, only 5 decisions about Medway Council's adult services, and all of these were closed without a detailed investigation. So just kind of suggesting that we are successful in the early resolution of these complaints. And yeah, I'll just open up now to questions. Ouch.
Members, any questions around complaints and compliments?
I think I have one. Just get it out. So regarding the number of recorded complaints, how much do you feel these reflect the true level of dissatisfaction, given that some individuals may face barriers to complaining, such as lack of awareness, digital exclusion, language, and what steps are being taken to identify and address the underreporting in complaints, particularly for vulnerable and seldomly heard groups?
Thank you for your question. I think one thing I would say is that we do make, we try our hardest to make complaints as accessible as possible. So we always offer a variety of ways for people to make complaints to us. Jackie, do you want to expand on that a little bit? Sorry.
Yeah, thank you. So on every email, every letter, any information that we send out, there's QR codes on the bottom so that we can ask people to respond. I've talked about recently with the right sizing, we've got a new engagement team. So the engagement team have created a website called Change Together Medway for people to join and talk about adult social care and their experiences. So not just necessarily from a complaints perspective, but actually how can we learn differently? Because some people will won't raise formal complaints. They'll raise angst and you know, make sort of emails to social workers rather than doing that formally. But the work that we're doing as part of our CQC transformation is about reaching out to harder to reach groups. And we're working, the Health Watch, sorry, at the back there, working with Health Watch, VCSE, to look at how do we do that, specifically for the reason that actually sometimes people don't want to come to a statutory service. They don't want, you know, they feel uncomfortable doing that. So, we, you know, by bringing in our partners, that helps us try and gather that information.
Just on that, there isn't a way to kind of measure or ascertain what is the gap. You would say, like looking through the data and analysis of what's going on in the community, how much you would expect the dissatisfaction to be and to what is actually being recorded. There isn't a number, your percentage you feel like it's missing. You can't come to that kind of number, can you?
I'd have to go away and have a chat with our performance team and complaints team to see if that's something we could do. It's not something I've been asked before, so I wouldn't want to say yes, but I'm happy to go away and look at it.
Councillor Wiley.
Thank you. First, on compliments, it does not give last year and the year before's numbers, whereas with complaints you can compare them, which I just found that strange. If I carry on. On page 105, you've got AMHP and Doles, and there was only 2 complaints, which for that service area, I would have not expected more, but more would have seemed to have been in keeping. As I said earlier, on safeguarding with just 1 complaint, I think that must be reflect well on the service. Yep, I think that would do.
Thank you, Councillor.
I'll pick up on the bit on the compliments first of all, if that's okay. I think you're right to highlight the fact that there's no comparison.
The reason for that is, although we've always gathered compliments, it's something that only recently we're becoming a little bit more proactive in doing. So we've raised awareness across all of our complaint handlers around the fact that we do even capture compliments. There's just as much learning that we can get from compliments as there is from the complaints. And so through, we've now introduced mandatory training for complaint handlers, and as part of that we're encouraging our staff that, because I believe that there are compliments out there that perhaps aren't even being captured. So I think that's why Nakaya has quite rightly pointed out that we're now looking at the comparison of how many compliments we're getting to complaints, because that gives us a good picture. We all know that people are probably more exercised in telling us when something is going wrong, and so therefore we really value the fact that our customers are taking the time to tell us that something's going well. So I take your point. I think perhaps what we can do in future reporting is we can actually give you those comparisons to actually show if those compliment values are growing.
And the Dowells?
Yeah, absolutely. So you would think actually that for the very nature of those roles, you would get more complaints. But actually, if I talk about the AMPs specifically, first of all, actually we've been complimented about how well our AMPs work with people with ill mental health, and acting as a real advocate for them, looking at opportunities so that they don't end up being placed under section in a mental health hospital. So that's the reason that we don't get a lot of complaints from an AMPS perspective. The same reason with Doles. Actually, there's so many people involved. So there's doctors, mental health advocates, the BIAs are independent. So again, it's such a long process with so many people involved. And then from a point of when a DOLS is authorised, actually that goes through a really, really strict, robust process. So again, if there was if a DOLS came for authorisation and as a senior leadership team we wouldn't agree with it, then actually we would send that back to the author and say that we needed them to go away and have a look at it. And that means that's why we don't get the levels of complaints.
And if I can come back with one more, which I've... the level of complaints in percentage terms has risen, well, 20%. You know, in numbers is not so bad, but do you know the reasons for that? Are we looking for them more, managing that better? You know.
So I think there's a mix of that. Some of that is we've got more management oversight in place at the moment, so we're picking up things that are happening. So we're then working with our frontline staff about practice and so on and so forth. So obviously that's sort of starting to trickle through, and some of that's having an impact, which is where we see complaints. The other part of it is we have got more staff in place now, so actually we're doing more work, so we're seeing that naturally happen.
And if I make a quick comment, it would help to give it some context if you said how many people we serve, people that are our clients, if you like. I didn't know how to phrase it, but which I assume is quite a high number, which gives that some context, that's all.
Yeah, so we've got about 3,600 people that are receiving care and support, and then we support around about another 4,000 that aren't. So yeah, in comparison, we'll increase that going forward.
Yeah, no, going over to Councillor. Okay, I've got two more to go, and then we're going to close this item. Councillor Amberdish.
Okay, cool. Thank you for the report. My question is to do with the ethnicity of the complainants. The white British level is disproportionately higher. 88 complained out of like 3,331 in total, which makes about 3%. So the average percentage service users making complaint, I'm not too sure how you get that only equating to 3%. And yet, if only, say, 2 Black, Caribbean, African make a statutory complaint, that makes up 2%, of which 113 are adults using services. So I'm just not sure how the maths is adding up there. But my question is more to do with the insights from the expectations of the users, irrespective of ethnicity. Have you got any way of tracking that? For example, if the 88, whether or not it was black, white, whatever, have you got any way of measuring what they're expecting the service to provide within that service? As a way of measuring, it might be like a free text box or something, I'm not too sure. I didn't see it.
So with regard to the ethnicity, I will look at that, because I think we were asked once before to actually provide a breakdown of the ethnicity of the clients that we serve in Medway, so that we could do that comparison. So we can go away and do that, because I think that would be then helpful to understand the difference. With regard to the insight, the heads, so we're looking at it as part of our transformation programme anyway, because it was identified by the CQC that we needed to do more around learning and so on and so forth. So the heads of service responsible for their own areas, as complaints are coming in, they're actually starting to capture the data separately to look at actually what are the themes, what's the understanding, how are we learning. And then I talked about the engagement team earlier on as well. What we want to do is then go back to people and say, have we met your expectations, and what was it you were expecting? It's interesting from a safeguarding perspective. It's actually something that's asked. It's part of the assessment. Did we meet your needs? What are your expectations? But it isn't generally for everything else. So we need to pick that up.
Thank you.
Thank you. And finally, Councillor Jackson.
Thank you. I'm really quick, and this is more of a frustration than really a question. It always surprises me that lack of communication and information, there's more complaints than the ones that are upheld, and it's free. Just telling people what's going on and everything isn't a thing on our resources apart from time. And like, I'm just as bad. I've learned that when I'm doing my ward work, just because I think I'm doing something, not everybody else knows that I'm doing it. So a quick WhatsApp to say I am. Do you know what I mean? I think that's what I'm saying. Hands up. I'm learning too, and I just think it always frustrates me when it's always at the top. And really and truthfully, if we just put ourselves in that position, just for a moment, them complaints would come down.
So we had our management team meeting yesterday, so team managers up, and I always use what if it's you? When you ring a bank or an insurance company and you don't get a response back, how does that make you feel? And actually we're doing exactly the same. So Councillor Murray spoke earlier on about wanting to see if there's something that can be done from a digital perspective. So we are looking at that. At the moment, teams use their phones to WhatsApp clients, but we aren't doing a good enough job. I think, Michelle said to me earlier on, if you do look at the number of people we support in comparison to the number of people complaining about communication, it is small, but I want it to be better.
It's just the one that stares out. But it's true, because you just get frustrated till you put a complaint in at that moment in time, don't you? Like that's, yeah.
Thank you, Councillor Jackson. And thank you, Michelle and Nakai as well. Thank you. I know you've sat here for a very interesting couple of hours, and we do appreciate it. Can I just say, first of all, before I go to the decision, I just want to thank Sandy Weaver, who sat here many evenings, even when I wasn't chair, right up until a late hour sometimes. I used to be here till gone midnight sometimes. She was our previous social care complaints manager, for all our hard work and compassion over the years dealing with our social care complaints, and we wish her a wonderful retirement. If you do speak to Michelle, if anyone does, please pass our thanks, because she went pretty quick I didn't think she'd want to fuss. So can you pass on our real gratitude, because she's done an amazing job. So, and not say you two are not going to be doing an amazing job for us as well. Vice Chair.
I move that the committee notes the report.
Is that seconded? And agreed, members? Agreed. Thank you very much. Thank you very much for your time. Thank you. Item 10, members, the task group. It is a late hour, and there is unless anyone's got a pressing comment, Councillor Wildy, on the task group, I can just give a bit of a self-explanation at the beginning, which will help you through it, unless people's got anything major to add to the task group detail. Councillor Wildy.
One very quick question. I mean, I do have others, but where are the sites where the air quality is measured? Do we know? Could I be sent
it's our 3 or 4 air quality zones. I think there's a Gillingham, there's one up...
If someone could let me know, yeah.
Oh, isn't it? It's in the report.
Oh, well, didn't. No, fine.
Councillor Cook.
Is it also just worth noting, as mentioned, as Vice Chair of Regen, we had quite an extensive discussion at Regen as well about this report.
Oh, yeah, you did, and you added that on. Okay, Councillor Galvin.
Very interesting report. It's good that the air quality element that we are measuring is going down, which is the nitrous oxide. And that's probably through, we've got more electric cars and hybrid cars. But there's the other side of that equation. Because electric vehicles are much heavier, the particulate mass that is coming off the vehicle through the wear of the brakes and the tyres is going to counteract that. And I think while we've got the nitrous oxides coming down, which is good, and ironically, when it comes to diesel engines, the more efficient that diesel engine is at combusting fuel, the more nitrous oxide that's given off, which, so in fact on large marine engines, for instance, they've had to actually reduce the efficiency of the engines in order to reduce the oxide. So it is a very complicated issue, but I think it's something we need to keep reviewing every once in a while, because whilst we're getting, as I say, we're getting the nitrous oxides down, and it's just not the small particulate matters, because anything below 10 microns can actually get into the bloodstream, you know, through your lungs. But there's all the other bits and pieces, and with modern lubricants, for instance, contain a lot of quite noxious chemical elements in them as well. But it's a good report. But I think perhaps we need to go away from just measuring nitrous oxide and look at some of the others. And the thing that worries me, particularly with the particulate matter, children are going to be more affected because they're lower down when they're walking along the street. They're the ones that are going to get those fine dust particles. Those of us, particularly over 6 foot tall, you know, we're breathing in that nice fresh air, but our youngsters at their knees are not doing so well. I think it's a good report, but to be honest with you, I didn't think it went quite far enough.
Thanks, Councillor Goldman. James, you've been sitting here all evening, so I'm going to let you want to come in. Sorry about that.
Thank you. Thank you, Councillor, for those comments about particulate matter. It's obviously of great concern. Very pleased to report it's reducing in Medway. So just worth coming in there. So you are right, absolutely, with your kind of assessment that braking and vehicle usage is increasing. Sorry, has the potential to increase that as we see those transitions to heavier vehicles, but it is reducing in Medway. The emphasis of the report on the public health actions that we've put in there are mostly around taking individuals' exposure to a personal level so that they can reduce their own exposure. Regardless of all of the activity that the council, and I'm sure it was covered during the RSET meeting, discussed through transport and other anthropogenic means, if we were to reduce everyone's particulate matter and nitrous oxide to low levels, there would still be a background level that would be poor to human health, and there's a responsibility for us to also shift the focus to also this report bring in indoor air quality measures, and that was a significant point that the members wanted to bring to the table.
Thank you, James. Councillor Crozier.
Yeah, just quickly, Chair, thank you. I don't know whether what happens to this report after it's gone here, but if you remember when we were on the task group, one of the big issues was the non-buy-in from heads of departments and the council generally. And if you look at the recommendations here, it's exactly that all the way through that. So are these recommendations going to Cabinet, or what's going to happen with them? Is something going to be done about it?
Terry, do you just want to talk about, I mean, I'm going to mention about that part, about the that management part in a moment.
Yeah, so there's some parts of the process which I will let the Chair expand on, but basically what happens with scrutiny reviews generally is they are commissioned by a selection of members. Obviously you were part of this one, and they undertake those scrutiny reviews on behalf of, usually it's one ONS committee, in this case it's two. They then report back to the ONS committee first so they can add any comments they wish to, and then the report does go to the Cabinet. The Cabinet, so it is going to Cabinet on the 18th of November, I think, yeah. And then the Cabinet, if they approve all those recommendations, They will then obviously be recommended on to officers, or in some cases it's to external organisations, etc. But yes, so it is going to Cabinet on the 18th of November.
Can I just thank definitely Councillor Crozier and Councillor Jackson, both endured that long task group. It was quite a long one. Also Councillor Brake, I know he's not here, but he was on it at first from us, so thank them. Can I just say, look, for me, the topic was too broad. We were dealing with not just only inequality, it was dealing with all the access to public transport, everything else we were trying to deal with. And although there are synergies across the topics, it impacted on our ability to really scrutinise each one properly. So that sort of covers what you said, Councillor Galvin, because it was frustrating for members, I know, because and I think in future members recognise the importance of keeping the scope of the reviews very narrow, and they always have been in the past. This was a trial between the two, and I think it didn't work. The report, what we got at the end was good. The officers, James done really well. What we got was great, but it was too much in one. But secondly, and it's one for Leanne to take back, I think, for me personally, I think the review would have benefited from a member of CMT, the corporate management team, being a clear lead. We needed that clear lead. We didn't have that, or sponsor for the review, because it would have ensured it was given priority. And the priority it needed by officers too. And so I would definitely recommend going forward, and I want that noted in the report to Cabinet, that a member of CMT is definitely nominated to go forward, because it just stifles everything. And I know I wrote it down because I wanted to be clear, because I could have said so much more. But the one thing I will end on is that we underestimate the amount of work that democratic services do on these task groups. Across the board, but on these task groups. And I feel it was really unfair for democratic service officers, including on this one Stephanie, I know Terry assisted, but Stephanie, having to chase people to try and get an answer for councillors on a task group. It's just unacceptable, and I feel that by having a lead or a sponsor, you wouldn't have to put up with that again, and they would see it as... and James didn't. James has always done a cracking job. But I think other departments would have seen it as more of a priority if there would have been a lead or a sponsor on that. And they certainly didn't see it as a priority, and officers had to constantly chase. But we got there in the end. Terry?
Just wanted to add, in terms of the breadth of the scope, so as Councillor McDonald alluded to, this has been going on for quite some time. We have since agreed a task group protocol, which is now part of the Constitution, and within that there is emphasis around scopes being narrow and deep. So, you know, we'd already learnt quite early on that this probably was a bit ambitious, so hopefully we will avoid that going forward for other reviews.
It'd just be nice for that comment to definitely go to Cabinet, though.
Yes.
Vice Chair. Oh, sorry, Leanne.
Thanks for that, and I will take that back. I guess for me there is a balance between members having a free hand and what you're describing, I think, is if you're not getting something back from corporate, then maybe you needed some authority to escalate to. That is there. It could have been escalated to me, for example. However, I think, you know, and I absolutely accept what you're saying. I think the point for me as a senior officer is when those recommendations are accepted through council, because that's when the recommendations are going to have to be driven. Otherwise, it'll just be something on a shelf, which, you know, is a waste. No.
Yeah, we definitely don't want something on a shelf or just another badge or become an air quality champion. Didn't want another badge on me. Vice Chair.
I move that the committee approves the content and recommendations of the report that fall within the remit of the committee and refer it for consideration by Cabinet on 18th November 2025. In addition, that the committee recommends Cabinet to agree that for all future scrutiny reviews, a member of the corporate management team is identified to lead or sponsor the project.
Thank you. And is that seconded? And agreed, members? Agreed, thank you. You'll be really happy to note that item 11 has been deferred. So now we're on the work programme now with Terry.
So I have nothing directly to add to my report. However, we might want to have a quick couple of minutes talking about December. Chair has alluded to KMPT being called in, potentially CCAM. Work programme for December looks horrendous. So we might want to think about what we do around December.
Yeah, just looking at, go on, Councillor Wiley.
Sorry, this is relevant, but just to make it worse, I do think we should see the residential nursing care before January when it goes to Cabinet.
So already, and we definitely put that down, already the agenda, if you look for the December agenda, it's horrendous. You know, I have a real, tonight is just a one-off. I don't really want to ever take these meetings past 3 hours ever, and we've been pretty good on that all the way through, or even less. But looking at the December agenda, we'd be here till midnight. I think there are enough items on there to really take us into that time. I have been asked about calling KMPT in because obviously they've failed their CQC and it's not looking good for them. And also, I don't know if anyone saw it on telly, but the ambulance CCAM was on dispatches on Channel 4 on Monday, and that was quite that was quite enlightening too, and not in a good way. So we'll probably have to call them in as well. There is a suggestion we could have 2 shorter meetings. Have a meeting with just 3 items, 3 or 4 items, and then the other one, and then they're short and we keep them together, or we go with a long meeting in December. Me personally, to be able to do it properly, you'd probably need 2 shorter ones to do it right. But I know the diaries are mad and calendars mad, but that's one thing. The second thing I do want to say, and I just want to pull it out there to members, is that I know it's coming up in an agenda with all the chairs, is that trying to go for a 6 o'clock start. At all ONSs, but there'd be feedback and people can go back. It was just trying to get it at 6 o'clock because people don't have to sit till late then. But I know that's difficult for people, including myself at times, that have to come from work. So, but you'll get that through. But
Sorry.
Go on, Terry.
And just to add to that, it is more difficult for us because we have so many external organisations as part of this committee presenting. I mean, I know tonight we don't normally finish this late, but it is difficult to ask for NHS colleagues to be here, let alone our own staff. Yeah. So yeah, our meetings are generally quite packed.
And just with that, finishing that, I think Leanne, you did have a. Can I just introduce Leanne at the back there from Health Watch? You did have a space up here with your badge and a microphone. You don't have to worry, but don't come up now and then you have to go. But next time you're here, you'll be very welcome, and please make sure you come and sit up at the table. But welcome to your role in Health Watch. Welcome to that. Members, any questions on what I just said about the work programme or anything? We'll come out with more information about what you feel about the times. Anything else? Okay, fantastic. Vice Chair? I think so, Leanne, I think. Yeah, should we ask, we'll ask Terry to explore the 2 meetings, we'll see what everyone thinks, what you guys think.
I move that the committee notes the report and agrees the work programme as set out at Appendix 1 to the reports, subject to accepting the proposed changes, which Democratic Services are going to explore the possibility of having 2 meetings to break up the agenda currently planned for the December meeting.
Yep, seconded. Agreed, members? Agreed. Thank you very much. Thank you. And please have a good evening. What's left of it. Take care. Thank you.
Thank you all.